Thank you. This is the Standing Committee on Health and Social Development. My name is Gord McNeely. Today is Wednesday, January 15th. And I just would like to start by seeing if we get a motion to adopt the agenda. Yeah. Keith McDonald. So today we're going to hear from the considerations of motion number 1, calling on the Legislative Assembly to refer wellness to the appropriate standing committee. We have a couple of guests in today that we're excited to hear from and hear a presentation. We will entertain questions at the end of their presentation, and when we do that, we'll probably give a chance to maybe ask 3 questions in a row, and then we'll just do a couple rounds, and everybody will have plenty of time to ask their questions. So what I'll do is I'll turn it over to our guests, and they can introduce themselves, and then just feel comfortable to present, and this is a great topic. Thank you.
Good afternoon. It's a pleasure for me to be back here. I'm always happy to come and talk about health-related issues, and this issue is, of course, something that, as I mentioned to you previously, it's something we all think is important. Wellness is important for everyone, and it will take a lot of work by all involved as we work together on this particular area. I'd like to introduce us both. I think we are both full-time public health physicians. Dr. Sabapathy and I work as public health physicians, and just as other physicians may specialize and focus in different parts of medicine, like palliative care or surgery, our area is in public health. Dr. Sabapathy has specialist training in public health and preventive medicine at University of Calgary. He has a Master's of Business Administration, a Master of Science, as well as a clinical fellowship in applied public health research. He has been working as our Deputy Chief Public Health Officer for the last 6 years here in Prince Edward Island. I have been here in my role now for over 12 years, and my background is medicine, but I also have a master's and doctorate degree from the University of Oxford with a focus in health policy decision making. And when we look at it together, in terms of our medical training and postgraduate training, we have a 24 combined years of training. And just thought we'd set that in context a little bit about who we are. Our responsibilities are under the Public Health Act, and we have responsibilities in different areas, under health promotion, communicable disease, environmental health, and assessment and surveillance. And these are really consistent across the country. Now, today, really, we're focusing on one of the areas under our office, and these are different sections we have, and we're really focusing on the health promotion section today. And then today we're going to focus more specifically on what is wellness, and then what is the evidence behind why we need to focus on wellness and chronic disease and health promotion here in PI, and then suggest a framework for a way forward. It's not necessarily going to be a simple or quick fix, but it's an approach to wellness on PEI. So I'm going to turn it over to Dr. Sabapathy, who is doing a lot of work in this file.
I thought we could start, there's 4 sections to this presentation, but I thought we should start talking about what wellness is. And that word in itself has so many diverse meanings in society today. All the way from spa treatments to cannabis edible products can be put under the banner of wellness. But what does it really mean from a medical perspective? Certainly we have the Department of Health and Wellness, so it's adding something to the word health. Some departments around the country are just called the Department of Health. So what is that addition? And it really goes back to the World Health Organization's formation in 1948, where they defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. So it's not just about curing the disease, it's about something else. And here we get this split between healthcare and wellness. Healthcare, some people call it disease care, because we're looking to eliminate the disease, whereas wellness is a positive concept about keeping ourselves in a state absent of disease, yes, but more than that, It's on a continuum, it's holistic, it's person-centered, and it's far upstream of what we see as provider-centered care with hospitals, physicians, and medications. And because of that, a lot of what we're talking about today lies outside the health sector in other areas of society, in other departments, but in broader community structures as well. And I'll put that in the setting of the 5 global trends that are affecting health around the world. Globally and here in PEI, we are growing as populations, we're also aging. We're moving into cities. That's putting pressure on environmental sustainability, which is a prerequisite for good health. And that's putting a question mark around our public health care systems for those countries that are lucky enough to have them. Are they really sustainable in the face of this? The 5th factor is the one I want to focus on, which is the rise of chronic disease. And when I talk about chronic disease, I'm talking about these 5 chronic disease clusters: cancer, diabetes, cardiovascular disease, chronic lung disease, and this broader area of mental health. And they have in common this sense of a long duration, slow progression, and although we can cure some of these diseases, often we can only do symptom management. And when you look back, the black line being mortality rate declining over time, this is US data, but it's very similar to Canada. You can split that into the purple line, red line, and the blue line. The red line is infectious disease, which has gone down over time, and chronic disease has maintained relatively stable. So now, after the point of 1950 or so, which is the constitution of the WHO, we see that the majority of mortality around the world is caused by chronic disease. And what proportion is that? Around 70% of global mortality is due to chronic disease, and that's around the same here in PEI. And of course, this presents new challenges for health into the future. Communicable disease used to be about finding that bug, that microorganism, and stamping it out through immunization and good infectious disease control. But now, chronic disease is really more about health behaviors. Cancer, diabetes, those types of things are related to modifiable, this is good news, modifiable behaviors. And about 2/3 of those, and we'll leave mental health aside for one moment, of the 4 physical disease clusters are due to these four modifiable behaviors: tobacco use, unhealthy eating, harmful use of alcohol, and physical inactivity. We don't have time in the scope of this presentation to talk about the mental health model. It's a bit different. But to give you the sense, and the United Nations released this commission report under the WHO that the failure to implement proven interventions to address those risk factors is really leading to an escalation of health, economic, and societal consequences in all countries, and that does affect us here in PEI. What it looks like here in the province is this graph here looking at provincial health expenditures from 2010 to 2018, increasing rapidly, that's the blue line, over this period of time. But not only that, but the dotted red line there is the proportion of government spending that goes to health. And you see that proportion going up as well, reaching now over 40%. And that, of course, squeezes out other government services. A lot of that increase is due to those 5 global trends, including the rise of chronic disease. It begs the question then, why don't people change their behavior? Well, it comes back to the illusion of choice in many respects. If we take the example of healthy eating, and you look at the choices that faces at convenience stores and in some aisles of our grocery stores, or you have a youth walking home and knows that there's no food at home and they pass all these fast food places, how much choice is involved there in fixing your craving at the time? So we know really that behavior is related to social factors, which we call the social determinants of health. That's education, employment, income, and the natural and built environment that I just used in the example. All these factors shape our choices, sometimes radically, and lead to different levels of chronic disease in different populations. And that's why we talk about health inequity. These differences between population groups, where you see some people getting a lot sicker than other people, and it's systemic and it's avoidable, so we say that it's unfair. So an example we use is levels of unemployment in some pockets or communities being higher. We know that's heavily related to tobacco use, and it's not surprising then in those same communities that later on down the road, about 15 to 20 years, we see higher rates of lung cancer in those same communities. So wellness is a state, and health promotion is the process of enabling people to increase control over and improve their health. It is about personal choice, but it's also about creating those structures that make choice easy or difficult. And so we talk, when we talk about wellness, then we should be talking about health as a resource for living. The focus is really largely on chronic disease, those 5 chronic disease clusters, 4 health behaviors, and this pathway from social conditions to behaviors to disease, and the impacts that has on health and island prosperity. The solution being health promotion, which is what we'll be talking about.
So, sort of moving on, really to pick up on Dr. Sabapathy's comment on costs. These are from the public accounts, the government of PEI, looking at the breakdown of some of those provincial health expenditures in terms of what goes to health PEI and then what is more in the department, and what has focused on health promotion, and which is a small percentage. Now, it's not to say there's not health promotion also being done in other areas, but in terms of targeted, specific funding. So we put it up there because I do think that it is relevant in terms of if we want to make some changes in terms of that growing expenditure in health. We need to look at how we're spending our money. The section that I would like to talk about here is the evidence, and what lays out the evidence about why we need to focus on wellness. And under the Public Health Act and our mandate, it includes population health assessment. And there are 2 particular reports I'd like to highlight here. The first one being the PEI Chief Public Health Officer's report, Health for All Islanders, and the next being the PEI Children's report, Investing in Our Future. These, I'm not going to go through all the details, but certainly highlight a couple of parts of each of those reports. Dr. Sabapathy mentioned the social determinants of health, and certainly our first report found that our social determinants of health are significantly influencing chronic disease here in PEI. And we particularly looked at income and social status in that report. And although some of it may be intuitive, it was the first time we had broken our rates of disease down by income and social status for our adult population here in PEI. And certainly we were struck by even the Honorable Roy Romano's report back in 2004, which says a healthcare system, even the best healthcare system in the world, will be only one of the ingredients that determine whether your life will be long or short, healthy or sick, full of fulfillment or empty with despair. And and I think it still holds true. So in the report, we talk about the fact that low-income islanders certainly have the greatest risk factors. And we talk about the daily smoking rates being highest for lowest income islanders at 23% versus 12.4% for high income. Heavy drinking being higher than for low income islanders. And 2/3 of those in low income having higher rates of physical inactivity and also lower rates of fruit and vegetable intake. So we're seeing, as Dr. Sabapathy mentioned, some of the same trends internationally here in PEI. So an unequal distribution of the social determinants of health is leading to health inequity here, differences in health outcomes that are unfair. We have our lowest income islanders who have the highest rates of heart disease, hypertension, diabetes, chronic conditions, and treated mood and anxiety disorders. And chronic disease rates are considerably higher in PEI than in Canada. And moreover, chronic disease rates are much higher for islanders with the lowest income compared to those with the highest income. And again, we talk about obesity, diabetes, high blood pressure, heart disease, chronic disease, mood and anxiety, and our rates of smoking being higher in PI than the rest of the country, and having lower fruit and vegetable consumption and lower rates of physical activity. And then moving into the PI Children's Report, certainly found that the chronic disease risk factors and outcomes for island children follow the same pattern as for the general population. Almost 25% of island children under the age of 18 live in low-income households. And I think that is on its own always a sobering statistic. Now, measurement of child and well-being is complex, and it's hard to have a standardized list of indicators across the country. But we do used as much as we could indicators nationally and international indicators to inform the selection based on PI's context, data availability, and feasibility. And our data came from different departments across government. And we looked at indicators in the physical and mental health area, as well as childhood development, cognitive development, and social environment. In terms of highlighting a couple of those areas would be healthy eating. Children with low family affluence and PEI were less likely to report eating vegetables, and the opposite was true for children with higher affluence. And again, some of this may be intuitive, but it was the first time we had measured it so specifically for our island children. In terms of physical activity, there were significantly fewer females reported meeting the guidelines than the PI average, and students with high family affluence were more likely meeting the guidelines than the PI average. And only 20% of students in grades 6 to 10 were meeting Canada's physical activity guidelines. And over a 5-year period from 2013 to 2017, the average obesity rate among 4-year-olds in PI was almost 10%. And children with the most deprivation were significantly more likely to be obese, while children with the most privilege were significantly less likely to be obese. And this is an example of an indicator with very strong data. And it enabled us to look at mental illness among our youth with a socioeconomic lens. And we had a high level of confidence in these estimates. And children with the highest deprivation were more likely to use health services for mental illness, while children with the highest privilege were less likely to use health services for mental illness. And then, and finally, food insecurity. Children and families that report difficulty buying food due to expense. And again, these were preschoolers that were ages 3 to 5. And again, this is always difficult to see this kind of data. So our island children are impacted. Island children with the highest material and social deprivation and the lowest family affluence have higher rates of nutrition risk, food insecurity, and obesity. They have higher rates of tobacco, heavy drinking, and cannabis, and lower rates of physical activity and fruit and vegetable consumption. So in terms of some key findings, that certainly risk factors and health outcomes for island children follow the same trend as for our general population, an unequal distribution of social determinants of health leading to differences in health outcomes. And while they may even have minimal effects on their own, when combined, they have a strong interactive effect, and exposure to multiple risk factors over time can have a cumulative effect, leading to additional risk factors to well-being. In summary, we have social factors influencing behaviors, which are influencing our chronic disease rates here on PEI. We want to talk about how social factors make behavior change difficult, particularly for vulnerable islanders. But on the good news, at least 60% of islanders intend to act within the next year to improve their health and well-being. And Dr. Sabapathy alluded to it as well. It's to try to make the healthy choice the easy choice. And in terms of going forward, and some of this was outlined in the reports, looking for government leadership to enable islanders to increase control over their health and improve health equity through redistribution of social determinants of health. A refocus on health promotion and wellness, and that's why we're happy to be here to talk about it today. And that social determinants of health and wellness, as mentioned earlier, it doesn't lie just within the health sector, but it's multi-sectoral at all levels of government, communities, partner organizations, and individuals. So it is really, truly for everyone. I raise these questions more just so that we keep them in the back of our minds, and I brought these up in different times over the last year as well. When we think about wellness, what can we do to address broadly the social determinants in order to improve the health of children and ultimately adults as well in PI? How can we address risk factors for youth, such as tobacco, alcohol, and cannabis? And how can we reach disadvantaged families and their communities without identifying or stigmatizing? So I'm going to turn it over as a particular, at this point, to Dr. Sabapathy.
At this point, I'd like to take a small diversion from what we've been talking about before we get to what we're proposing as a solution. And that's to talk about the difference between health promotion and programs. And I want to take, of those 4 risk factors, the one that perhaps you didn't think I would take, which is the case of alcohol. And I want to go into that and just speak about programs and their limitations. As we know about alcohol, it's no ordinary commodity. It's known to be attributed to over 200 disease and injury conditions. Those conditions can come from acute, chronic, or dependent harm, and a key risk factor for cardiovascular disease, cancer, and diabetes. We have Canada's low-risk drinking guidelines, the evidence-based guidelines, and they're actually quite generous in their approach. They're evidence-based. 2 drinks a day for females, 10 drinks per week, or 3 drinks per day for males, 15 drinks a week. If you drink underneath that, you're in the low-risk category. However, 22,000 islanders are drinking above the low-risk drinking guidelines, and this trend has been increasing over time versus the Canadian trend, which is stable. At highest risk are young adults, males, and vulnerable groups. An emerging trend is the increasing rate of female drinking. So it's a leading cause of harm in PEI. Second, we believe, after tobacco use for modifiable causes. And of course, when you have that level of harm in a province, you have related economic costs well captured in this very well-done study, broad scope and very in-depth analysis looking at economic costs of alcohol in Canada, and we have a PEI cut on the data as well. So $26 million attributed to alcohol harm in PEI, second only to tobacco use. You can take that $26 million and break it down by where it's going, hospitals, physicians, substance use treatment, etc. And the question really is, can we have a program that addresses things upstream from a wellness perspective that reduces the level of alcohol harm in PEI? And what would that program be? We could probably come up with some ideas, but I'm going to just throw one out there that's commonly used, and that's corporate social responsibility campaigns. These are annual funded campaigns by industry and crown corporations that try and get the message out for people to drink responsibly. Now, the thing about these campaigns is that we found in our review in the Chief Public Health Office is that they're ineffective. We looked at 13 systematic reviews. These aren't single studies, but studies of studies. So there's many studies underneath these that indicate 4 that said that CSR campaigns are not effective. 8 said that they actually promote drinking. And 1 said that they are effective, but that one was funded by the alcohol industry. Why do they actually promote drinking? We don't have time to cover that, but it's how the message is delivered. It's the focus on the individual versus what the corporation is doing to shape your own drinking choices and things like that that actually turn it the other way. What if public health does the campaigns instead? At least there's no conflict of interest there, and we do have the ability to measure the result. Well, we did run this campaign in PEI in its third year now, I think going into its fourth year. And the emphasis was on the low-risk drinking guidelines and getting that message out to islanders. Very successful in terms of its reach and getting it out there, but in terms of knowledge that the guidelines exist, that only increased by 7% over a 2-year period. Moderate or minimal success at best, and that's only knowing that the guidelines exist, not what the guidelines actually say, and it's certainly a far cry from behavior change. So really, it is not about programs, it's about policy. And we have the World Health Organization's best buys on alcohol policy, which have always remained the same: regulate distribution, restrict or ban advertising, and increase prices. We've seen the same call for action from the Canadian Institute for Health Information in their national report in 2017, pricing, availability, and greater government control. We see the same in the Public Health Agency of Canada's report in 2015, pricing and taxation, control of sales and availability, and restriction on alcohol advertising. And we see the same in Canada's Chief Public Health Officer's report in 2018, pricing and taxation, control, availability. So how are we doing with respect to alcohol policy in PEI? Well, we have the Canadian Alcohol Policy Report. It's the second of its kind. It comes out every few years. And we have a PEI report card on that. And we received a failing grade. We're the only province to receive a failing grade twice consecutively, in 2012 and 2017, along with Newfoundland. And you can see the policy domains in which we fail in respect to alcohol policy. And I do direct that report to your attention. In summary, we continue with the message that social factors influence behaviors in chronic disease, that programs in and of themselves are largely ineffective. I'm not saying that programs aren't a part of the answer, they certainly are, but a single bullet, a single program is not going to solve what we're talking about today. It requires a comprehensive approach to health promotion, and that includes healthy public policy, but it's not limited to that, and we're going to talk now about what the comprehensive approach looks like. This is the final section of our presentation. The way forward. The way forward, as we've been discussing, because it lies outside the health sector, has to be together. How do we influence all those conditions that make the healthy choice easy or difficult? It's not just government, it's partner organizations, communities, and individuals. And I put here, I'm sorry, the font is a bit small. If you look at the department mandate letters for each department, there's elements of wellness in all of them. From our explicit mandate to develop a comprehensive wellness strategy to education's universal pre-kindergarten programs, housing and availability under social development. We have PEI Food First strategy for agriculture and land, the active transportation model of transportation, climate change being looked at with environment, finances increasing the move to increase the basic personal exemption, economic growth, focus on skills and labor, and fisheries, building rural capacity, and justice, public safety, working on community safety and well-being in their policing approach. And you can look at it another way, that's the mandate, well, what actions are underway, and maybe I won't go through all of these here, but you can look at actions coming out of all the departments that are doing something around wellness, and particularly draw your attention to agriculture and land with the PEI Farmers Assistance Program and their approach to mental health promotion amongst the farming community, for example. So lots of great work being done, but it's not just about government, it has to be about communities. And I talk now about our wellness grant program that we started in 2015. So we're 5 years into that, 83 projects in rural and urban areas across PEI, large organizations and smaller groups. Some of it's population level targeted, some smaller organizations that we're working with, and all ages. And those grants have been very effective at mobilizing community action around wellness, because often it's the communities themselves that know where their wellness needs are. We also have the Health Promotion Conference. It's, I don't know this for a fact, but it probably is one of the longest running health promotion conferences in the country. We're now entering our 14th year. We always have over 200 people that attend until we're at capacity for the room. And we've been increasing there the percentage of the community that's involved. So it's not just health people anymore, but it's everybody showing up to this conference. Our last theme being the power of community. Together we can. Having said that, there is a role for leadership on this file. We have the department's clear mandate in their letter to work on wellness. And we've been positioning ourselves over a number of years to try and lead more effectively in this area. We've transitioned health promotion to the Chief Public Health Office. We've done the reports that Dr. Morrison described and struck a health promotion committee. And we're building an operational framework and a brand around that. And I'd like to share that with you now. It's called Live Well PEI, Together We Can. That's the brand, but it's also based on an international best practice framework. It's about promoting healthy living, coordinating all those activities that we saw on the recent slides, building partnerships with communities, informing and engaging islanders, and encouraging healthy public policy. It deals with those 4 risk factors, plus the mental health area. So that is engaging people to be more physically active and less sedentary under Move Well, to eat more nutritious foods and foods that are good for you. And that's following many of the guidelines around healthy eating that exist in the country. There's Breathe Well, which speaks about tobacco use, protection, prevention, and cessation. And Choose Well, which addresses alcohol use, as we saw earlier today, and better choices around that. And finally, Feel Well, which addresses mental health, but from an upstream perspective of reducing the stigma and building resiliency in communities to deal with the stresses of today. So back to a more quantitative view of this, what would that look like if we had these 5 risk factors plus mental well-being? We put cannabis in there as well, as it's beginning to be an issue as well that would be closely associated with tobacco use and alcohol. And there are actual guidelines around those of and targets where we should be. So you can compare where we are to where we would like to be, and you can set a goal by 2025 and by 2035. And with the goals that I've set out there for 2025, that would mean 18,000 more islanders engaging in physical activity if we move from where we are now to meeting the guideline. 18,000 more islanders adopting a healthier diet. 6,000 more islanders tobacco-free, using alcohol but not in a harmful sense. 12,000 more islanders not using cannabis harmfully. And 3,000 islanders being more resilient and connected. And the reason that number is so low is because mental health and addiction is trending in such a drastic direction the opposite way. To actually stem the tide would be significant progress, and to actually have 3,000 islanders feeling better about their mental health is actually very significant. We just have 3 slides.
Yes, so just to continue on, this would be what we look at is an operational framework for Live Well PEI to really address the social determinants of health and health inequity and chronic disease. So community engagement, which really is essential in fostering healthy living. It's community-driven initiatives resulting in sustainable impact. The healthy public policy being another branch. International evidence and best practice demonstrates that healthy public policy is the most effective way to make healthy choice the easy choice. And since chronic disease is impacted, as we've mentioned different times, outside the health sector, healthy public policy must work across sectors. And then the other branch of that being good governance is about how we lead and engage others. The framework requires multi-level, multi-sectoral engagement with proper oversight to ensure strategic objectives are achieved. And finally, monitoring and surveillance. It's necessary to ensure that the other three functions are informed by the best available evidence on chronic disease and risk factors of Islanders, and we measure the health outcomes of Live Well PEI. And when we talk about these areas, more specifically, community engagement is about making sure we have a web brand and an interactive platform to use, expanding the wellness grants that we already have considerably, community capacity building, making sure we're doing good public education and awareness. That we talk in the healthy public policy area about health in all policies, and in terms of all department mandates and activities, but also with municipalities and communities. And in terms of good governance, looking at a Live Well PEI Council, as well as one focused on youth, and having a secretariat who will help coordinate. And monitoring and surveillance, launching a provincial wellness survey so we get the best data from all Islanders in these different areas, and putting out a Live Well PEI report card. And we'll end with this video and brand has been looked at by different government departments, and it was went for focus group testing by an independent firm, and this is a little video that I think captures it together. Do we just press play? Oh, this is.
Live Well PEI is a way of life. It's a principle, a purpose, and a promise. It's all of us coming together, growing together, and making a difference together. It's about choosing wellness, communities, organizations, and all levels of government, creating supportive environments that empower all Islanders. It's about making it easier to eat healthy, be more active, focus on mental well-being, make informed choices about alcohol and cannabis, and avoid the harmful effects of tobacco. It's taking realistic steps to reach our goal of health for all Islanders. By putting the well-being of our communities first, together, we will live well.
That's it. Thank you.
That's great. Well, thank you very much. That was a fantastic presentation, and I think there was a lot there. And I know I was writing things down, and it's great that you're here. And what we'll do is we'll probably take our time with questions. I mean, this is such an important topic that there's no question that's bad, and we can get somewhere with the next little while. So, if anybody in the committee wants to lead us off, yeah, Trish.
Great, thank you, Chair, and thank you so much for that presentation. Every time I hear both of you speak, I learn so much, and I really appreciate you being here today. Thank you. One of the things that you mentioned, and there's so many things to unpack here, but the health in all policies approach, and that's something that I found very interesting, and I know that that's been taken on in different ways in other provinces. I believe Newfoundland has actually kind of been a leader in this with a health in all policies unit that was created, an executive council, and I wondered if you could speak to, what more we could do here in Prince Edward Island to make sure that we really are considering health in every aspect of everything that we do.
Do you want me to start? Well, I was going to just make it, because that's a great question, and of course health in all policies is something that we talk about, and I just thought before I forgot about it, that because there's a discussion, as you mentioned, across the country in health and all policies, but there's also health impact assessment that you may hear about as well, and some of that health impact assessment is embedded in the health and all policies, and I mean Quebec has it in health impact assessment in their legislation. So we're learning certainly from other provinces, and so it's definitely an area where as we talk about the multi-sectoral aspect of health promotion, really it's health in all policies across the board. So anyway, I just wanted to make that little...
Yeah, and I think that's so. Certainly when I look at health and all policies, or we look at it, there's that reactive approach and the proactive, and I think both are needed. So the health impact assessment, a part of that is to look before we finally pass any piece of legislation or policy, a major policy, that it's vetted in some way, similar to environmental impact assessment, and we just check to see if there's any major impacts that are going to help affect somebody's health or population group. The other way is to look at it proactively, is how do we reach out to community organizations and other levels of government to say, you know what, this is the best practice around the country on this particular health issue. Would you consider adopting it? It's up, obviously, their choice to do that, but we can help facilitate that discussion and see if it can be integrated. So.
Great.
Yeah, Trish.
Correct me if I'm wrong, but I don't believe, we here in Prince Edward Island are currently, engaging in health impact assessments on a regular basis, and all of the, policies that or most of the policies that we're moving forward. That's not a regular thing that we do here at this time?
Not formally, no.
Right.
Informally, I think it occurs, whether it's about putting a structure and a process around it to make sure we don't miss opportunities.
So just one more follow-up question on
Yep.
that. So is that something that you would like to see, move forward here in Prince Edward Island as well? And if so, have you seen any particular models? You mentioned Quebec, and I had mentioned Newfoundland. Is that something that you are looking at in terms of recommendations to put forward to government? Or do you have any specifics on how we might best move that forward?
I'll jump in. I think what we see is if we have a Live Well Council on PI, that kind of recommendation would be coming from that council. So that it can have that community involvement, it can have cross-government representation, and have that recommendation go forward. But I think from my perspective, that would be you'd want to have that in place so that you can also have someone that is best trained and experienced in commenting on what is the best, if there is a health impact of a certain policy in place. I don't know.
Can I ask one more follow-up
Sure,
question?
Trish.
I know that other people have questions as well, but I'd like to just sort of unpack that a little bit. So a Live Well Council, who would you see being part of that type of council? Just asking some practical questions, because I think this is an area that we certainly can do better. I'd like to hear your thoughts on that.
Yeah, I think it's always hard when we talk about the breadth of what we just presented on, to be a large table. But we certainly see the key government departments being there, the provincial departments, but we also see the community groups that are so key being there as well. Health PEI, there's an aspect of reorienting health services that we look at, health promotion, even at the point of care. So you can see the health provider being there as well. And then you need, of course, individual representation from community members as well. So we have put together terms of reference for it as a draft, and we have some ideas, but I think it's a matter of getting the right people there and not having the table too big, which is always a challenge.
And certainly wanting to have one that also has some focus on youth as well. Because I think the voices may be a little bit different, and important to capture that. And also, we talked about the risk factors in a younger population, and I think, and one of the things we didn't mention earlier, which ties in a little bit, is that our department was also given a mandate to work with early childhood about the first 1,000 days, which is really the indicators in those prenatal and the first couple of years. So I think we're looking forward to working on that as well, and I think it ties into this file.
Wonderful. All right.
Brad Trivers?
Thanks, Sharon. Thank you for your presentation. The results of unhealthy living are shocking and well documented, and that's why we have to be so proactive. So it's every time you see that sort of presentation, it really drives that point home. And thank you for listing some of the initiatives that government's been working on, not just now, but leading up to now, the last administration. One might have been missing there was the active transportation fund. that, I'm not sure if that was on the list or not, that we got rid of the free driver's licenses, right? And we're going to fund the active transportation fund. So that's hopefully going to contribute to wellness. And I also wanted to just clarify something, Chair, if it's all right with you. The school food program, there's some misinformation out there. It is a pay-what-you-can model. Nobody's going to be turned away because they can't afford it. There's not going to be a means tested or anything. The school food program is going to be accessible to all. And I just wanted to clarify that. So along the lines, so the Live Well PEI initiative, I can see where you're going with that. Very important. I mean, wellness is about being proactive, as with a lot of the programs talk about First 1,000 Days, the pre-K initiative, school food program. So one thing I'm noticing there, it very much has a marketing feel to it right now. And I'm really looking for recommendations on where we can really take action. One program that I came across, and I don't know if you've seen it, I guess is my question, it's We Schools. Maybe you've heard of them before, the We Schools programs. They have a We Day program where it's about motivation and with students, but they also have a new We Wellbeing program. And it's something that I've been meaning to bring to you anyhow. But I think it might provide some of that programming that allows us to move away from more, the marketing and advertising, but right to actual programs that we can implement within communities, in this case, mostly through the schools. Anyhow, and Chair, that's something I'd like to bring up to the committee, and I can bring it up in new business if that's a better spot.
We might get you to do
with
that.
This We Wellbeing program, it'd be useful for the committee to learn more about.
These are excellent suggestions. And too, I just might add too that we don't really have to look too much further than Central Queens too for something around activity. They do an amazing wellness week. A winter carnival week, it's the best thing on Prince Edward Island, and I believe that. So Michael Clare there at the school, I'd check in with him, and if we can replicate that, it gets all the kids active. So I want to pass it over to our guest too to.
Well, I just to follow up, Minister, I think. I mean, of course, you need some kind of brand and framework to hold all this approach together. But really, good health promotion is about community development. It's about what's going on in Central Queens. It's about what's going on at schools, and that until we, get councils in place and do, wellness grants out in the community and have a lot of it from the grassroots, that's really going to be what drives us. And so some of that is awaiting some funding and structure around it, and so we're sort of proceeding with that. So it's not just about a brand, but it's about actually making sure we proceed with what we know is international best practice around grassroots community driven programs that we can work with and help coordinate and provide a framework for and some leadership in government.
Excellent. Okay, that's great. Great discussion. We're going to go to Michelle.
Thanks, Chair, and thanks for the presentation. I appreciate it. I will just add as a comment, I find it interesting that you picked alcohol, and here we're announcing updates to our liquor store, and we're building a new liquor store, so I find it interesting how you selected that one. It's a very timely point. But I just want to build on what Trish here said, and about your structure, like the structure that you suggested as a council. What are some of the existing structural barriers within government that would that might hinder developing that type of structure?
Well, I think one of them, maybe you mentioned a few, but is that we have so many already. I think there's a lot of councils and interdepartmental type committees that are going on. There's only so many people in government, for example, who can attend, and from community organizations as well. And I think that's where we just have to look at, I'm not sure I have the solution for that, but we just have to look carefully at who needs to really be a part of this, and how does wellness kind of connect to those other groups. Like, what are the best connections, I guess,
Yeah, I mean, I agree. I don't see it as any particular barriers as such. I think it's a really exciting opportunity to put our arms around wellness, to recognize it's something we all believe in, and we all think we want to have a more well community for ourselves, our children, our families, and a community. So I think it's to try to, because there's really good things going on, but how do you connect it? How do you make it more powerful by bringing it together? So some of it will be challenging, and it will be not something that will be fixed. These risk factors in chronic disease take a long time to fix, and so it's a commitment. And I know Dr. Sabapathy and I often say it's something that we look at as something before we retire, not something that will happen in terms of changing the outcomes. But I know if we don't change the outcomes and don't make our changes here to help influence health behaviors, which will influence chronic disease, we really are doing a disservice to the population and the health of our population here in PEI. So a little bit long-winded answer to say I think there's some it's a good question, there's some challenges, but I don't think I perceive any barrier of people not wanting to do something better and get involved in wellness in this province.
Okay.
Michelle?
Thank you for that. So when you look at government, you see silos, and one department can make a decision, for instance, extend road construction, not realizing that the same truck drivers that are driving trucks for road construction are also the ones that are taking in the harvest. And so sometimes when decisions are made in certain departments and it impacts other departments, there doesn't seem to be a lot of conversation that happens in between the two departments. So how would we go about de-siloing our current delivery models for health and social development services?
Well, I think it builds on your comment too, Tricia, about trying to figure out a process around health and all policies, and those are the decisions that are made about if there's a new road that's put in place, are there really good options for active transport, or bike lanes, et cetera. Are those being taken into consideration on all of those, not just legislation, but decisions that are made, and sometimes really tough decisions have to be made no matter what, but it's to try to make sure there's a process in place to do that. I don't know if you have anything to add there.
Okay, thank you. Go ahead.
Good, okay. Heath McDonald?
Thank you. Great presentation. Kind of scary, some of the statistics in there, but especially for the children. But so I guess, the schools, the educational component of this is likely an unbelievable starting point because it's a captive audience. And the school food program, which we initiated and the government of the day is going to continue with, I think is phenomenal, and it could hit, based on their statistics, somewhere around 6,300 students right off the bat for healthy lunches, and I think that's a wonderful start. But are we doing enough in the school system? Because to me, when you look at the statistics of the alcohol and drug components of your statistics, we've talked about guaranteed income and things like that, and after seeing this presentation, you look at it and say, gee, if we provide additional funding, are the students or the children going to get that, or is that going to go to cigarettes and alcohol and cannabis and whatever else? There's a real fine line here. I know there was a $500 tax credit that was promised. Those types of things to me are the incentives that we have to keep pushing hard for, to get people to recognize the importance and to allow them to afford the exercise programs and that. But again, getting back to the education component, are we doing enough in the school systems?
Well, I think the issue around substances, Mr. The the issue around vaping in particular was perhaps left too long. I'm happy to see now the movement amongst schools and principals to be addressing that from a policy perspective, from an education perspective, and there's a lot of nice interdepartmental work with education and health getting together to try and do that. So I think there's opportunity there, but actually I'm pleased at how the direction that it's taking now with the response in that area as an example. Can I speak to it?
Well, I mean, I think the answer is, I think there always could be more.
Yeah.
I think to your, I agree with you. It's how those behaviors are influenced at that school age level, and I would even say the earlier in school, the better in some circumstances. And so I think there's always opportunity to do more. And I mean, when we set up our health promotion committee, it was really wanting to look at, that to go in that direction as well, recognizing that really close link between education. Of course, the challenges are also that how do they find time to try to make sure their math and writing and English are all meet the levels they need, but trying to realize that these other aspects will have such a big component as well on their lives. So it's trying to balance that, but and continuing to do more work. And we're also, some of the wellness grants have been out into sort of that kind of area as well, and I think that's been exciting to see some of the partnership work that can help in that area. And I mean, I say that with. I raced home before I came here, and I found 4 young, well, there was someone at home, but they were all eating lunch at the house. And then I'm thinking, I hope I have healthy options there. But I mean, it's how do you make sure that some of those, that we're all doing the best we can.
Yeah.
Keith McDonald?
You answered one of my other questions, but I'll just go back to your grants. So I think if I seen it up there, it was 300,000 and 80 some projects. That doesn't seem like very much to me. And maybe it was my government, I have no idea, but I'm just saying, looking at it, saying, you do the math, that's pretty limited.
Absolutely.
So is that the total budget for that?
That's,
yes.
Yeah, that's
It is.
cumulative over that period of time.
Over 5 years?
That's right.
Again?
So we would like to, we have a proposition in that would increase that significantly. And I think that is going to be huge. I mean, that is, so we have, because it really is exciting to think for communities that they would have access to some more funding. And we, I think, I don't know.
Yes, and I think that's the piece where it gets quite tangible, not just a branding piece, is the wellness grants and the boots on the ground type of approaches where it comes. Yes, we're looking at a significant scale up. This is what we're looking for. And it's been nice to have that experience over the last 5 years. We've tried different models because the wellness grants can work different ways. And I think we've actually got a nice model now, but it's a matter of taking it to the next level with the funding.
Yeah. Okay, one more.
Keith McDonald?
So we're just working towards elected school boards. And to me, and I have Ontario's here in front of me, but they actually put leaders of health or mental health onto those committees and the school boards. So we talked a little bit about here the barriers and impediments of silos and what have you, and I've seen it, I've been there, and kudos to people like you guys to keep pushing the envelope. So, but would that be like, and I keep coming back from the school system because I think, again, that's where it all starts. And I mean, yes, we can work with those that drink too much, and I see the advertisements, and the first thing I did was looked at the bottles. I didn't even read so if I'm doing that, most people are going to do that. So the message is not getting out. But are those the types of things that we need to do to continue the conversation? Because it tends to get lost. It tends to get lost in Brad and I arguing over infrastructure. It tends to get lost in arguing over budgets or whatever. But if it's coming from outside the bubble or outside the circles, you know, the well-being strategy, if you incorporate that into that, like I'm not saying Ontario is perfect or anything, but it was just something that kind of caught my eye because we're dealing with elected school boards. But if we start incorporating people and their sole purpose to be in those committees and those boards is health, wellness, then all of a sudden you start seeing the change because the conversation is never ending. Is that something we should be?
I mean, I think it's something that we should be doing more of, but I think we've started doing some of it.
Okay.
We have, for instance, some of our health promoters now sitting on different, not elected school boards, but on different
that was just an
committees. And for instance, in terms of mental health down in Montague, we have people sitting in on other things, but we need to do more of that and have enough people. All the wellness grants also get supported by health promoters, so sometimes they get pulled into the community to help support those grants. So, but absolutely doing more, and some of it is us even having the opportunity to go and meet with other groups. For instance, just recently, you know, going maybe to home and schools, to Rotaries. Those are also parts of the community to help the understanding there and involvement to continue that discussion.
Thank you. I'm fine.
Corey, he hasn't asked a question yet. So. Corey Legal?
Thanks, Chair. I'm just curious, you had mentioned vaping. What work is being done right now amongst principals? Have they come up with any policies yet or any?
Yeah, I think there's a interdepartmental working group with health, education, somebody else is at the table. Is Justice there? I'm not sure. And they are looking at, you know, policies around it and how do we educate our youth. So those are the two areas that they're looking at. So that's good. I know the school well-being teams as well are looking at that issue. But yeah, so there is a group that's pretty active, and I think the work's evolving. Yeah.
Corey?
Are either of you two involved with that group?
No, but we have one of our health promoters that reports into us who's very active, and I think is leading that group.
Corey?
Do we have any idea how many students would be vaping? Does PEI have any statistics? And
so youth vaping, and I'll have to check the exact number, so I'll give you the approximate. It doubled over a 2-year period of time from around 15% of high school students vaping to around 26 to 30%. And that was, I believe, from 2015 to 2017. So a rapid increase in vaping amongst high school students. PEI.
And I think certainly in some of our police colleagues would say it's just a tremendous issue for them dealing, you know, the ones that work with the schools or work closely with the schools.
Corey?
I have an intervention, Chair.
Sure, intervention.
All right. Thanks, Chair. And when we're talking about vaping in schools, it's something, of course, that is being raised by many, many parents, home and school associations, and we have Sterling Carruthers within the department. He's our school health specialist who's devoting a lot of his time to this issue and has gone. They have a meeting with the home and school associations across the province twice a year, and I was at the last one he presented there. But we're making sure that the policies within the schools are up to date and are trying to address the issue as best as possible.
Thank you, Minister. Corey? Last question.
Last question?
Yeah, for now.
Just for now. In your opinion, do you think that obviously Nova Scotia just banned all flavors? Should PEI do the same and ban all flavors? Because my private member's bill comes in, it's 120 days after Royal Assent, so, and that's their regulation, so I know Health and Wellness will be looking at writing those regulations, but I think that we should just follow Nova Scotia's lead and ban all flavors, so I'm just kind of curious what since you're both here, what your opinions are on that.
Right. Now, I think the two issues there, one around flavors for nicotine-based vaping, which I understand our Minister in Health is currently consulting on whether there be any exemptions other than a full ban. Certainly, we would like to see that as restrictive as possible. There's also the issue of cannabis vaping, which is not products that we're selling in the province right now, but a question whether there should be any flavors in cannabis vaping and what we should do with those products. And I believe Nova Scotia and Newfoundland took some action in that area as well. So.
Those are big. It's a big file.
We'll have a chance to come back to the court. Trish?
Thank you, Chair. So I just wanted to take a minute to acknowledge the great work that was done in a couple of the reports that you referenced, so the CPHO report and in particular the children's report. I think that these reports are incredibly important in highlighting, the social determinants of health, as you mentioned, and particularly the challenges that we face around social inequality. It's not something that we like to talk about. It is an uncomfortable topic to face, and I think it can be very easy for us to slip into a blame narrative when we talk about poverty. And as policymakers, I think that we should avoid that sort of approach because, as you mentioned, Dr. Sabapathy, you gave the fantastic example that was so, really got down to the heart of the matter, where you have a youth who, is walking home and they know that they don't have, healthy choices at home and they're hungry and they're going to pass all these fast food places. What choices do they really have? I think about the stress, just the impact on your well-being and your stress when you don't know where your next meal is going to come from or how you're going to, make ends meet. So I think these are hard topics to look at, but if we're going to take a serious look at well-being and wellness, then it's not enough to just look at the outlying factors. We need to actually look at what are the core things that are contributing to these challenges on our island, and poverty and social inequality is certainly one of them. So thank you for that. I wanted to also highlight the community engagement as one of the key pillars of your framework. I was so pleased to see that there, of the Live Well framework. I think that our communities here in PEI are a great resource and asset, and do so much. I won't take a sidebar about what's happening in Tyne Valley right now, but with the rink and just the incredible way communities come together. But I think that, we have such community strength here. I wanted to just ask about the wellness grants that communities are able to apply for. Is there any outreach or support for communities who might be less well-resourced, less affluent, smaller communities to be able to apply for these grants? Because you do need to have some resources in place, people who have the time and capacity to apply before you can get them. So,
yeah, it's a great question. Thank you. And I think one of our earlier iterations of wellness grants, that was kind of an issue. Some people wanted to apply and they didn't know how, or didn't have the resources to complete the application and to conceive of a good wellness idea for their community. We've changed that model now, so actually communities and groups that apply can signal what they would like to do, and they'll work with one of our health promoters to develop the application together. And I think that model is working better, and there's always more enhancements that can be made to it. But I think we're liking where that's going, and I think it helps the groups that struggle to apply. Yeah.
Trish?
Thank you, Chair. So yeah, that's wonderful to hear. And these wellness grants in some capacity have been going on for a while now. So I'm wondering if you could tell us a little bit about what types of programs you've seen that have been very successful, and just tell us a little bit more about that.
Sure.
There's some
good ones. Yeah, and I don't have the list here with me. Some of our favorite ones that I thought had a great impact. One was Soup for the Soul. That's at the UPEI, and it's a regular get-together time for students. Very low cost. You're serving soup, but it's a time to talk about the struggles that students go through. Certainly very helpful in terms of mental health promotion. Widely successful in terms of getting those discussions going. Another one I think of is Count Your Cubes, which is one that we ran with Heart and Stroke, where they were trying to measure the amount of sugar-sweetened beverages that people are consuming. And a lot of people well, we don't measure what we're drinking. So can you count the number of sugar cubes and track it over a 1 month period, and then challenge yourself the support, those social supports, to try and reduce that amount and improve your health.
There's one with Inclusions East.
Inclusions East, I know that one, but I'm not as familiar with the description of what they're doing. Some others will come to me.
We'd be happy to forward you a list of
We
some
do
of
have a
our
full
favorites.
list of
Our favorites.
Doing some
They're all-
videos.
Yeah, absolutely.
Trish?
Yeah, so thank you, Chair. No, I would love to see that list. Do you have any examples, or is it often that municipalities, smaller municipalities, because I think you just listed the university and community group, municipalities themselves are applying for these grants?
We do. I'm just going back in our presentation.
I think you went by it.
Did I go by it?
Yeah.
Sorry.
And I suppose while you're looking for that, I'll just add, I'm asking some of these questions for, groups that might be wanting to apply in the future, give them some ideas.
So I think our municipalities include North Shore, that we've listed some of those smaller communities are where these are maybe based, but I'd have to pull out which ones over that period of time. But we can send that.
That would be wonderful. I do have just one more question on this, Chair, if that's all right. So one of the challenges that we've seen with other grants in all different areas is that you get funding for a great project, you start it off, and then, where's the sustainability because the funding ends. So how do you address those issues with these grants around sustainability, and is it only new initiatives that are able to apply?
Yeah, so we divided the grants, and there's 2 streams right now. Can always be reconfigured, but one of those streams is for scale up of ideas that we know have been proven in some way, usually on the ground versus in the literature. And then there's more funding available for those that will actually help launch them and get them going. Some of the other ones with smaller amounts of funding are kind of experiments, if you will, and we're just trying things out. But I think it's a great question, and that's why one of the reasons we moved to the 2 streams of funding to try and get after that.
And I think that's one of the questions in terms of because all of them are evaluated, and they are evaluated and sustainability is one of the components of that. And again, I think going back to the earlier comment, it'll be very exciting to see potentially more impact with a bit more funding.
Thank you.
Great. Thank you. Michelle?
Great, thank you. And just on that, I would think maybe posting it on a website to give other communities or organizations an idea of what's an idea that you could actually submit to get that grant and just make it public. Maybe not how much they got, but maybe that would be a way just to kind of get the word out. Is the 300,000 always tapped out?
Well, it's 50,000 a
It's
year.
only 50,000
Oh, it's- sorry.
a year.
So it's 50,000 a year. Is it always tapped out? Like, is it always fully used?
Mostly through those two streams, and it sort of sometimes there's not we used to have a close-off date of just one time, but we found that didn't work for all organizations or communities. So now it's sort of staggered.
Okay.
They can apply at different times. So which works better for some projects that might be more, for instance, like a summer garden co-op or growing. And so that would be more, the application would have to be in time for that to sort of get underway, whereas there might be other ones. So it's to really try to work with communities to get that. But I think some of them are certainly online, but I'm not sure that all of them are. So it's a good chance for us to check and make sure that they do get online.
Okay, great. So if I could go back to I guess the structure. So how do you work with health PEI with evidence-based information approaches and services? How do you get that pushed out to front lines?
Great question.
And this is towards wellness,
Yeah.
towards their approach to wellness.
Yeah.
I mean, I think historically, we use the Ottawa Charter for our approach to wellness, and there's 5 areas of it. And one of the areas that was a focus of our last health promotion conference was reorienting health services. And it's the one, not in PEI or Canada, but around the world, that historically has been the most difficult to have traction on. And you would think it would almost be easier because it's in the health system and we can work with the delivery provider, but it's not, because there's such a strong and I think warranted reason to be focused on curative services. So that's been the issue. How do you do it? And then I think, again, this idea of the Wellness Council, having them there so they can look for opportunities throughout their organization. I think there can be incentives at the point of care that are provided, not always financial, but sometimes. Even how we create fee codes and these types of things can reorient how you look at the individual who's coming in and the questions you ask them around their social factors and their risk factors and the type of intervention you take at the point of care. So there are ways to address that. In the absence of taking a proactive approach and really trying to do it, it's not going to happen. We know that over many, many years. So yeah, it's a matter of doing it.
Sorry.
Sorry, I'm just going to add to that because it's certainly a challenge. And I think, I mean, we're talking in a lot of cases about primordial prevention and really upstream prevention. And there are other parts of like primary, secondary prevention that are done within the health system and health PI in terms of some screening and lots of good examples. I think there's ongoing discussions and relationships about how we work better with health PI and to work with them about their strategies around for instance, lots of work together on the cancer strategy. We've been involved in some of their cancer strategy development, the diabetes strategy, so that that there is that working relationship together, but I think there's always a chance to do more too.
And
Michelle?
And so on that, is there a governance structure in place at Health PEI that allows you to be able to communicate, or is that just you hope that somebody is interested in hearing the discussion?
Just the normal structure.
I mean, I think the normal structure that exists at Health PI in terms of governance and ours here, I think our governance, as we lay it out for Live Well PI, will help maybe with some of that linkage. And I think there's lots of discussion even ongoing with Health PI and the department of how our roles and responsibilities are going to, how they cross over and what we need to do with some of that. And not just in terms of this file, but in all files, how we work better and more collaboratively with Health PI.
Okay.
I'm going to move to Corey. Right now we're just trying to limit questions till 3 right now. And we'll try to give another 15 minutes of questioning, and so make sure that you guys know that you'll be off the hot seat pretty soon. Yeah. Corey?
Thank you. I'm just curious how much collaboration between, like in terms of wellness with the public schools branch there is.
I don't know, I just thought for just...
I mean, we are in connection regarding the school food program, the school wellness teams, the vaping working group we're talking about. So there's discussions. It's more about, and the healthy eating, nutrition guidelines for schools. And I think it's really a matter of formalizing that more. I think it just happens more on a consultation basis, except for the working group with the vaping. So there is good discussion going on, but again, I think it's just more about coordinating all this better together. Did I miss anything?
No, I mean, we mentioned Sterling Carruthers' name came up earlier.
Yeah.
We do work quite often with Sterling Carruthers, and I mean, and when I go back to the children's report, we had the advisory committee for the children's report had the Deputy Minister of Education on it at the time. We had, as well as multiple departments and our McNack Confederacy. So the whole advisory committee for that report certainly was, and we used information from Public Schools Branch and French School Board to feed into that report. And in the report, I didn't highlight it, but were education results that were around math, reading, writing, so there's been some of that stuff. I know that's not addressing exactly your question, but those would be some of the linkages that we do have on a fairly continuous basis.
Corey?
The minister walked in just in time. Back to kind of Heath's comments, a lot of, and it was more, I guess my question was more around physical activity. A lot of, if you go to a lot of the schools, the infrastructure is very poor, and it's not, it's just successive governments that have ignored it over time, and Tory and Liberal. You know, like school soccer nets that are falling into the ground that have been there for 30 years. Montague High School has a track, the 400-meter track, which is, 10 years old now, and it's completely overgrown. Unfortunately, not too many people use it. I've used it a bit, but there's weeds growing up through it. It looks like it's about 40 years old. Students have to pay fees now to participate in school sports. It's not significant amounts compared to what you would pay for hockey registration, or something like that. But it is a barrier for some people, and it's something that honestly just drives me nuts. It just not just since I was elected, but just like we have a brand new school in Montague, and no one uses the 400-meter track because it's just goes to the wayside. And it's not on the school. They don't have the resources to keep it up. But here we are talking about wellness and physical activity, and we have this infrastructure, and it's not just there. It's it'd be the same at Charlotte, like other high schools as well, Bluefield. And I'm just talking more so because I've refereed soccer at a lot of the schools, and I've seen a lot of it. So, athletic departments in schools that squeeze by every year just to get by. They have to charge students fees, and I know this isn't your fault. It's more just a bone to pick because we're talking about.
A question here for the guests.
Do you think we should do more?
I think the answer is
yes.
Certainly, I think if we're going forward and we are wanting to address the risk factors that we talk about, and physical inactivity or increasing physical activity is one of them. So absolutely, I think everything is something that we would want to look at, and that would be not just in the school setting, but in the community setting, and the accessibility and the ease of that access for all islanders. So that's.
Corey?
And I guess just a comment too that a lot of the teachers, and we don't realize that, volunteer a lot of their time to coach some of these sports teams in schools, and it's quite a burden on them too. So I just wanted to make that comment. So I appreciate their work, and sometimes they just don't have the funding behind them.
When we talk about community involvement, you mentioned volunteers. I think PEI is so fortunate that we have some of that community involvement is so based on people volunteering their time and their effort, and it truly is what can make such a difference, and it will make a difference if we go forward and have a live well PEI community. So.
We have a 15-second intervention from the minister, and then we're going to move to Heath.
Only 15 seconds.
15 seconds.
Well, thank you, Chair. No, I figured since I'm the Minister of Education and Lifelong Learning, I should respond a little bit. And I'm not going to disagree with you. And, maybe we can, within the school system, leverage some of the wellness money and use some of the grants. And I want to give kudos to all those people who do volunteer their time, right? It is a matter of finding the money to do it because there's lots and lots of priorities in the school system. But I'm hoping that maybe the committee can make some recommendations on that front, because that always helps. Thank you.
Yeah, thank you, Mr. Minister. Heath McDonald?
So I guess listening some and going back to kind of the chronic disease, a lot of our discussion is based on reacting to some of this stuff as opposed to the opposite, which why we're here. Nutrition plus physical education equals a healthy child, lessens the burden on our healthcare systems and mental health. I know we're not there. Dr. Sabapathy talked a little bit about mental health, but I'll tell you, I mean, if we're getting our eyes open in some of these statistics, I'm assuming the mental health added to this would be phenomenal. And I know I attended the Diabetes Canada event, which many members attended as well, and by 2029, if I remember, there are like 56,000 people either that are going to end up with diabetes with a $22 or $23 million price tag. Like, it's phenomenal. I mean, I think sometimes, and I get Corey's, agree with him wholeheartedly on, I know we focus on academics, but if we don't have healthy kids, it's not much use having really good academics, because some of them are going to fall off. And I know myself and some of my friends that likely never only stayed in school because of the sports programs. I'm not taking anything away from them, but that's likely that kept them there. And if that goes by the wayside, then you're losing that segment of society. So, yeah, I think we can do a heck of a lot more. And putting aside all the other conversations, I sincerely think it starts with the Department of Education and building from there, along with the expertise that you guys provide and the courses that it is tough to get the time and the volunteers and that sort of thing and the infrastructure in place. But if we don't keep pushing the envelope, that diabetes thing is pretty phenomenal number. And you take 22 or 23 million out of your health budget, that's just one. That's not opioids, addictions, that's not alcoholism and addictions. I mean, it's pretty scary stuff going forward, and we wonder why we're putting 5.5% into our healthcare budget every year. Let's do preventive maintenance on some of this stuff and really focus on it. But that was just a comment. I have no question. I'm done for the day. I'll shut up.
Thank you. We'll go with Trish, then Michelle, and then I've got a couple questions to finish.
Thank you, Chair. So I just want to return briefly to the topic of child poverty, because it's staggering, as you mentioned, when you see the numbers and you realize that, I think you said 25% of children in PEI are living low income. And I've heard stats around like 18% for child poverty is still sort of the range that we're within, which is about 1 in 5 children living in poverty on Prince Edward Island. As a first step, what would you suggest that we need to do to start to decrease those numbers and really move that forward? It's a huge question.
It is a huge question, and I'm not sure we can have any one short answer for that. I do think you raised it earlier as well. When you highlight the fact that when we talk about wellness, we are focusing on social determinants, and it's not just, it's about all islanders, and it is about social determinants. And I think if we can continue that approach and that thinking, then that will help in that answering that discussion about how we address it. I know there's certainly work in government doing about poverty action and poverty reduction. I think this has a link to some of that work as well. And so I don't have a specific answer, but just to make sure that as we go forward, we continue to acknowledge that the social determinants influence our health behaviors, which influence our health outcomes. So if we really want to influence those health outcomes, we need to deal with the upstream stuff.
Trish?
Thank you. And I think, in terms of looking at the challenges that we face, particularly around child wellness, your children's report from 2017, that was quite a groundbreaking report, I believe, and incredibly important to move this discussion forward and keep it in the public, forefront of the public as well as policymakers such as ourselves. So I'm wondering if there are plans to release an updated report in the near future. Is that underway?
We've had that question come up recently. I mean, one of the challenges with that children's report was around trying to make sure we had good ability to even do a better report next time and making sure some of the data sharing issues between departments legislatively as well could be worked out. I think what we anticipate doing is well, we have some reports that will be coming out, not just specifically about children, but about our population, and they're going to be staged smaller reports over the next year or year and a half, and which will be trying to highlight certain aspects of what we've talked about today. And some of that work has already been completed, and we're going to try to get those out. And then because we'll be looking at some of the indicators again in that the younger cohort in that first 1,000 days initiative, I think that will be a time probably within the next year of really coming out to do some indicators in those prenatal and first couple of years, which will be really important. And we'll build on some of the work that we've done. And so there's always work on some of these reports, but that's our next focus, I think.
Okay. Thank you. I have one more question, I think, so I'm going to shift gears completely to something different. I'm wondering what roles you might see not-for-profits and other community-based initiatives, such as the Atlantic Summer Institute. What roles might they play in promoting upstream health and well-being moving forward?
Yeah, I mean, I think they're really, really essential, and I know that even some of our NGOs struggling with funding and those types of issues, but without that kind of a voice in the community, and they know exactly what's going on directly there with the clients they're trying to serve. We need their engagement. The whole model around Live Well PI is largely built around using their expertise and supporting them. So they're really, really critical to the whole endeavor and the sustainability of this. So,
Thank you.
And I think the Atlantic Summer Institute this summer is going to be on upstream mental health, having looked at that briefly.
Wonderful.
Michelle?
Thank you, Chair. So I just want to talk about, I guess, silos again. So are silos a barrier within health PEI? And really, for example, like what I want to get at is, are some chronic diseases given more funding support compared to others? And if so, is that based on evidence from your department?
I'm not sure how the funding. I haven't seen a budget that would be saying where money goes within health PEI. I certainly think, I mean, what we're aware of really is what we put up there earlier, that the bulk of funding towards health is certainly in health PEI, and not as much in the department. And I think, as in anything, there are certain areas in the health system which generate a lot of attention. So that wouldn't be specific one chronic disease versus another, but for instance, emergency department wait times may generate more interest than another part of health PI that would be dealing with a chronic disease. But in terms of funding, I just don't know.
No, that's fair.
Michelle?
So which chronic disease currently needs additional support or funding?
well, so from a wellness perspective, I mean, the great thing about it is the more you move upstream, the more it coalesces into actions around those 4 risk factors. And if you address those, then you address all 4 chronic disease clusters at the same time.
Okay.
So that it kind of, there's not as much of that competition of funding issue in the wellness space as there is more when you move down. And the farther you move downstream, the more you have to decide which disease you're going to treat. So there's that aspect of it.
So I think the smoking cessation is one of those examples where this smoking
that's a good
cessation is important for really all our chronic diseases, and will improve the outcomes in terms of cancer, COPD, heart disease, and diabetes. So that's an important risk factor to address, and so we've been doing some work on that. So, and then I think alcohol would have similar impacts on cancer, heart disease, etc.
Okay, that's right.
Michelle?
Two more, okay?
Okay.
I know you said 3 at a time, but I'm going to go for 4. Okay, self-management can be an effective approach to living well with chronic disease. How do you work with Health PEI to ensure that those living with chronic diseases are provided evidence-based treatment services to manage their conditions?
There are programs like Living a Healthy Life comes to mind. Not sure if that's still operational, but in those programs, because the model around wellness is to keep people well before disease enters, and now we're talking about people that have the disease condition. So our goal there would be work with Health PEI to make sure that comorbidities don't occur. So a person struggling with COPD is able to get physically active so that they don't get a diabetic condition as well.
Right.
So that would be our role. And you can still live a healthy life even though you have a disease condition. That's how but how it would actually work is more of a discussion of again, bringing prevention to the table with those people that have disease conditions already.
I mean, one of the aspects which we do support would be helping Health PI with some of the data so that we would, our population health assessment surveillance section under the CPHO would look at, help in terms of incidence and prevalence of diabetes and maybe ask certain specific questions to help in that regard and to give them some evidence about which direction they're going. So that part, there is some support given from a data point of view.
Okay. And then I do have one more question. Comment first, though.
Okay.
I was surprised to see that school-age children are below their physical activity numbers, like the threshold for physical activity, and I would think that that might be something education would look at, because yes, it's important for them to learn, but it's also important for them to get physical activity. And then I would just champion what we were talking about infrastructure, especially when a government is doing an expansion or building a school and they don't build a playground, or they tear out the playground and they don't replace the playground and leave that up to home and schools to pay for. So I know that that's not a question to you, and I just wanted to get that in there, that I think that that is something that education should absolutely 100% look at, and it shouldn't be on the backs of the parents to try to get play equipment out there. So my last question is there a steering committee within Health PEI that is responsible for chronic disease?
There's certainly a section that deals with chronic disease. I mean, I don't believe it's a committee, or certainly we're not involved in that committee at this point in time. But we've met with a couple of the senior people who have chronic disease in their portfolios, and some people change, but I met with them within the last couple of weeks, so that week, and it was the beginning of more discussion. So that's, and can I just comment on what, just in terms of when you're talking about the activity, and one of the slides I didn't put up from the children's report was one of the indicators was screen time. So, I mean, of course, our island students exceed the recommended screen time by the Canadian Pediatric Society significantly, both in terms of less than 2 and preschool, and those are clear guidelines. And so when it's difficult as mom of 4 kids, absolutely difficult to deal with the screen time, but as much as you can, even in the school setting and at home, trying to keep them as active. So I think it just speaks to your point of trying to make sure the infrastructure is there.
Yeah, thank you. I appreciate your presentation. Thanks.
And I'm just going to, I have questions, but where my passion lies with this. I could be here a very, very long time, and I'd like to, thank you both for coming in. And there's some of the key things that I looked at. Is 20% of the kids are not meeting, are only meeting the physical fitness requirements, the minimum requirements. And you'd also talked about, we didn't talk about it, 2 females are not getting as active as the males are. These are incredibly important things to remember. I'm a little bit concerned about there's 2 failing grades, and I've watched the wellness strategies over the time, and I would like to see us all work together on making this next one make a difference, because you talked about 18,000 more people being physical. That's a very big number, and I've been in this industry for 20 years. So it's a very big number if everything just stayed equal, but we're talking about an increase in that. So it's all hands on deck. And this committee, I think I might speak as chair of this committee, we'll be making recommendations to the ledge about motion number 1, wellness, and I think we see it here today. There were some amazing questions that the committee members asked, and it's all hands on deck. And the last thing I'd say is health promoters such as yourself are very nice. And it's time to continue to be bold, because this is very, very important. So we will continue our work here. I would like to perhaps consider bring you back in at some point, because I don't think we even maybe even scratched the surface of some of the questions about getting into a little bit more about the strategy, if that's okay to kind of think about for the future. But on behalf of the committee, this is important for PEI today. So thank you very much for coming in.
Our pleasure.
Thanks for having us.
So what we'll do is we'll take a short recess or a break, and we'll come back and discuss some other things. things started again. So at this time, we'll move on with the agenda, and there's quite a few things to update. We'll be as quick as we can through this next part of things, but I'll pass it over to Emily to give an update on the committee's work plan at this time.
All right, so you'll see in your agenda packet, so under item 4, that there's a few different things that has come to the committee's attention. So I provided an update on the list of invited organizations and groups that have come in, so that's attached to your document, and it was circulated to committee members yesterday. And I've also included 2 motions that were referred to this committee from the House, so motion 4 and motion 35. And then additionally, there's also been a few requests that have come in. They were circulated yesterday to the committee, and they're also included, I guess, on the second page of the committee updates. So it's kind of a general overview of some of the items that are before the committee. So on, I guess, 4A, the updated list of invited organizations and groups. So I've listed all the groups that have been agreed to in the fall. Invitations have been sent out. So now it's just a matter of scheduling those groups in. There was one group that was agreed to that I'd just like to touch on, which was the Downtown Charlottetown Inc., in particular their Navigator Street Outreach Program. An invitation went out to the person that was in charge of that program, but they've since left, and there's not a new person in that position. But the executive director of Downtown Charlottetown Inc. has offered to come in to talk to the committee about that program and give an overview. So since it was a different person than the committee had originally agreed to, I just wanted to bring it forward to the committee to see if you would like to proceed with that, to have the executive director come in, talk about the Navigator Street Outreach Program.
Trish?
Thank you. So I'll just, I think that we absolutely should have the executive director come in to speak about that program. What were the successes and challenges, and what are the plans moving forward? I think almost even more so, I'd like to hear more about it now. What are we going to do next? Surprised to hear that position is not in place anymore. So.
That's a good point, yeah. Very good. Heath McDonald?
So I'm just sorry I stepped in a couple minutes late,
Sure.
but is the position terminated?
Sorry, I should be clear. The person who was in there before left, and the position is open at this particular point.
So
there's,
the funding and everything's still in place as far as we know, it's just that the person,
yeah, the program is. Yeah, I guess that's, my understanding at this point is that it's just there's nobody in place at this moment because the person that was there has left the position.
Okay.
I'm assuming that the committee agrees.
They're hiring somebody.
They might be able to give some additional information on that to the committee.
So that's, that'll be the first order of business we'll get Emily to do is touch base with them and see if they can at least come in next week to provide an update and some questions if we can. I think we do have some space in next week. We have a long list of people to come in, so this committee, what I'm hoping to do is maybe schedule 2 presenters in a day and keep things a little bit moving along a little bit, and sell that today a little bit. Anybody else want to comment on the Navigator? Would that be okay to move forward like that? See if we can get them in as priority. Trish?
It's not on the Navigator, but just on something you just said about prioritizing. We do have a long list of presenters, and probably more coming up in new business, I expect. I wonder if there's any plans, Chair, to have a discussion about prioritizing at this point. What topics does the committee really want to tackle most urgently, and how we would organize that?
Yeah. Well, we can have that discussion now too. Feel free to lend your input here, and I know we all have important issues. I mean, I was just going to say there's 3 motions from the ledge into this committee, so that those would kind of take some sort of priority, but we're not. Yes.
Thank you, Chair. So I don't know that that's necessarily the case in terms of committee process and structure, is that you don't necessarily have to prioritize motions that come from the legislature. It's really up to the committee what they prioritize, is my understanding. I think I might suggest that we wait until we've had a discussion about the different groups that have requested to come and speak to the committee, as well as any that might be presented from committee members during new business, and then we can perhaps talk about priorities at that point, just instead of jumping ahead when we haven't approved or agreed that we should be speaking with all of just I think
Sure, yeah,
perhaps in terms of process.
It's an open discussion, and I respect your input on that for sure. Anybody else want input?
I'll
Michelle, yeah,
Sitting
sure.
in, I'll get to. So I would just say you've got some pretty stale agreed to dates here. Like, have you done follow-ups on any of those? Like, for instance, the Dorian relief or, yeah.
Yes. So I've reached out to the two groups there, and I just haven't heard back at this point a date that might work with them. I've indicated to them that Wednesday afternoons is the time slot that this committee has moving forward for the winter. I just haven't been able to confirm a particular date for those two groups at this point.
Okay.
And maybe I'll ask the minister, he's on executive council, has there been any discussion or any updates on when that report or when that they could come in and speak about Dorian?
Oh, Dorian.
You'd probably have to ask the minister that's responsible.
Yeah, I don't have,
He's on executive.
yeah, we haven't talked about that at executive council recently. But, yeah, if you just pop them off an email, I'm sure you'd have a
Sure, thank
answer
you.
quickly.
Yeah. Trish?
Thank you, Chair. So I appreciate my colleague bringing up, particularly around Hurricane Dorian, which is something that we, have requested for a while, and there was, sort of some back and forth. I wonder if perhaps it might be appropriate for another letter to come from the chair of the committee, just highlighting that is something that is still incredibly important to this committee, that we're still waiting for that. Perhaps instead of it just coming from the clerk, who has obviously done everything she can to reach out on this topic. I don't know what other people think about that, but it was just a suggestion I wanted to propose.
Sure, absolutely, and it'll be noted for sure. Heath?
Just wondering on the list of attendees and the prioritizing, if we could possibly, clerk, have a special meeting on that solely to deal with that, so it doesn't interfere with some of our scheduling going forward, so we don't have to move or cancel or add on time. It might take a half hour, it might take 45 minutes, just to prioritize what everybody decides to, is that something we can do, or?
I do believe that would be definitely a possibility. If it's okay with the committee, we could do a pre-meeting, maybe like next week, change the meeting time. I don't know if we're able to do that, or if we'd have to do it before.
So is the committee's interested in perhaps having a discussion today on these different topics, and then meeting at another time to then prioritize what the decisions of the committee will be?
Or do the discussion at that time as well?
Yeah.
I guess
That's
it's up to the
kind of my
committee.
thought.
The committee would like to have this discussion one more time.
Whatever, yeah.
We could do next week.
So we're talking about a work plan meeting for the committee, maybe
If we
giving
do
us
it
half an
half
hour
hour.
prior to a scheduled meeting.
Can I make a suggestion?
Michelle?
I don't know what everybody's availability is, but I also know the committee scheduling, and the availability is tight, right? Like, would everybody be able to just extend the hour and go until 4 and do it now? Like, I don't know if that's a proposal that everybody might be able, that just gives you an extra week, right, to start inviting guests and.
Sure. Yeah, and it's a good day to do it. I'm available. It's a great suggestion. Anybody else?
So sorry, is it what you had today?
They add to it, so I'd rather do that first and then.
Okay, yeah.
Keith?
I have new business to add to that list, so I'd rather do that, and then if you want to have the discussion, because they may affect some of your prioritized list.
Sure, absolutely.
May not, but
Yeah.
whatever.
Trish?
Perhaps what we can do is, because I also have new business to bring forward, so we'll have that discussion, then maybe check in with everybody, we'll see where we're at that
Yeah.
time, and see if we're comfortable staying longer. Does that make sense, everybody?
We'll set our time limits to 4 and maybe 4:15 if that's okay, and we'll just relax our way into it and make sure we get everything that we need done. Try to. Good suggestions. Corey?
Is there a work plan already for the committee?
Yes, it's attached to the agenda. Do you have that?
Yes, but I'm just curious why are we coming up with a new work plan if we have one?
There's new agenda items, so there's two motions that will refer to the committee that it's up to the committee to determine how they'd like to move forward. There were several requests that have come in that are also attached to the agenda there. And then, as members have mentioned, there might be additional items under new business.
It's getting busy. There's this committee covers a lot of different demographics, people, and different issues in Prince Edward Island. So we're trying to accommodate. Yeah. So what we'll do is, Trish's suggestion was good about Dorian. I do believe, I just want to ask a question. From the Premier's office, they wanted to complete the report. Is that a priority that we see the report, this committee sees the report before this group comes in? Sorry, what do you? Well, I'm asking, the reason why nobody has been in to speak about the hurricane is because we were waiting for a report. Now, we don't know when that report is going to be in. There's a standing offer for EMO or the Premier and those responsible to come in, and we're kind of in limbo, and I just want to see about, is that important that report comes in before? I'm going to send a letter as chair regardless, but I just wanted to have a discussion around that. Trish?
Thank you, Chair. Just to clarify, I do believe that the committee was not waiting necessarily on a report. That was what we were told, given back as the rationale from government why the Premier did not and the Minister did not come forward right away, is because they wanted to wait for a report. So from where I stand, I mean, I've said this all along, I think that having an interim meeting at this point, we must know some things about how that all went down, and we need to have plans for the future, because we never know when we're going to face another crisis situation like Dorian. Hopefully not soon, but I'd like us to be as prepared as possible. So I do think from where I stand, we don't need to wait for a report, and I would love to speak to them again after a report is complete.
Great suggestion. Anybody else? Corey?
I'm assuming they want to wait for the report for a reason, because it's the review of the response to Dorian. I understand why the committee wants to call them in earlier to politically grandstand. I understand that, but I'm sure there's a logical reason why they want to wait until the report's complete, but that's just my take on it. I completely get what the opposition is doing. It's probably something similar to what we would do, but I'm just saying that they're probably waiting for the report for a reason, so.
Okay, yeah, and it has been 4.5 months. It was a fairly substantial event, and I'm not sure if it's political grandstanding as a chair. I just want to see people talk about this and try to understand our mistakes and our successes around how we dealt with this, and you know, let Islanders know about our response. So, yeah. Trish?
And I will just suggest, I'm not sure we would consider it political grandstanding if we were to face a similar storm next week or next month, or, you know, who knows when. So it's really about being prepared, and Islanders have a lot of questions, so I do think it is a worthwhile conversation to start now in the public venue, which this is. But moving on, I suppose you had mentioned, Chair, that you're planning to send a letter anyway. I don't know if we need a motion from the committee to do so, but...
I think a motion would be the best, and the only other question I would have is, would you like me as chair to put timelines around that? I don't even know if that's possible, but I think that setting some parameters around having some people in to answer some questions is a good thing at this time. We've sent numerous letters and spent a lot of committee time talking about this. So that would be the only other question I have. Would you like a 30-day deadline for the Premier, EMO, and the Minister of Justice to come in and speak to this committee? Brad?
I'm thinking, why don't you just give the Minister of Justice and Public Safety a call and just see where they're at, and just have a conversation with them. That's what I'd recommend.
Yeah.
But you know, just say, you know, we have an open invitation to come to the committee, and hoping you could do so soon. Just wanted to see where you're at when you're planning to come in. I mean, I think you'll probably get a good response.
I'd rather Prince Edward Islanders see my letter to the minister and his response back at this point.
Okay.
Yeah.
Chair.
Corey?
I'm assuming it's probably EMO that's completing the review of the response.
I can't.
I'm just not sure what
answer that.
having the Premier here is going to accomplish. If it's EMO that is the, you know, they're the ones that.
Yeah. So the Premier has been asked, and he responded, and he said he had an interest to come in, and He has responded in his letter. We can bring those letters back up and see what his response was, but I do think it's just coming in and speaking to the committee. I think he's the premier of the province, and he faced something that was difficult for all Islanders, and he should come in and just have a discussion with us. Yeah. Anybody? Trish?
But just to add to that, I do think that, including EMO in this discussion, as well as the Firefighters Association, I believe that was the original intent of the invitation. And of course, any other experts that, the Premier feels would be useful to add to that discussion, I'm sure we would be open to that. The most important part is that we are having that discussion at some point soon so that we can start to have a little more clarity on the response and what could be improved for next time, what worked well. And it's a discussion that does, in my opinion, does not need to wait until a formal report is complete. But I don't know how much more time we need to spend on this right now. Anna, so can I just say something quick?
Sure.
I'm going to go ahead and move that the committee, the chair, send a letter to the Premier just reiterating the request for the invitation to come and speak about the response to Hurricane Dorian and in terms of timelines. Last time we said before the next sitting. I mean, to my mind, we've already put timelines and that didn't do anything, so I perhaps we just send the letter and say as soon as possible. So that's my motion, I guess. Send a letter reiterating the invitation for as soon as possible.
To the Premier, anybody else, or to the members?
Everyone that we had originally, yeah. So I believe we had the Minister, we had the Firefighters Association, I believe Emily was on there as well. I can't remember who we sent exactly.
Yes.
Oh, yeah, they were.
So yes, so I would say the same as,
Okay.
so yeah.
Would anybody like to speak to the motion on the floor? Court?
Has the committee written EMO? Have we wrote to EMO?
I think so.
Let me just confirm.
They're department heads, right?
Yes, they were also issued letters from sent to EMO.
Yes. Went to.
I just saw the first name, went to Tanya. So that was, yes, the answer to the question.
What was their response? I guess I know I should, if I was a permanent member, I might have received
The
that.
responses that the committee's received have been from the Minister of Justice and Public Safety.
Okay, yes, we did get a response back from the Minister of Justice and Public Safety, and verbal dialogue was discussed through the Premier's office, through the clerk.
Sorry, that's what EMO sent back?
EMO, no, they didn't send us anything back. They sent us something through Minister Boystops. Would you like to, well, we might as well get Emily to read the letter that was responded to, if you would like. Or
The most recent response from?
the most recent response, yeah.
Sure. So this was sent to committee members on November 12th. It came in from the minister's office, and they had copied all committee members. So it's addressed to the chair, Dear Mr. McNeely. In response to the Standing Committee's request on October 21st, 2019, for further information on the response and recovery efforts of post-tropical storm Dorian, I would like to share with members of this committee that the Emergency Measures Office has begun the after-action review process in keeping with best practices of other jurisdictions after actions of significant weather events, such as in New Brunswick on November 8th, 2019, the Department of Justice and Public Safety have issued a request for proposals to request to review the response efforts of this weather event. Attached is the copy of the RFP for your reference. It is our expectation that this process will provide a thorough and independent review of the overall response and recovery efforts and will be the catalyst for the Department's review of the Emergency Measures Act as outlined in my mandate letter. I am also able to confirm that the Emergency Measures Organization has conducted an internal after-action review on October 24th, 2019. They are in the process of compiling the feedback received, and if there are any actions in this compilation that can be shared, I will endeavor to do so. As Minister of Justice and Public Safety, I share all members' interest in ensuring our province will be prepared for the next weather event. I am committed to keeping members apprised of further determinations of the after-action review, both internal and external, once available, and it's signed the Honourable Blois Thompson, who is the Minister of Justice and Public Safety and Attorney General.
Corey?
So they're still working on those reports? That's what I would take from
It
that.
would, I can't answer that. You'd have to,
So they're not complete yet. I still have I completely understand people lost power for 2 weeks in some cases, and in my own district as well, and people are frustrated. And I'm all for holding executive branch to account, which I think I've proven numerous times. But calling the premier in to the committee to discuss the storm before we've actually had the reports completed, and then call them back in again to discuss the reports, I just don't understand the point of it other than to get a headline the next day in the paper. But I think we should also have Maritime Electric in. You know, why, the response to get people back on the grid 2 weeks, like, I think there's questions. I'm not saying there's not questions, but that's just my comment on
Sure,
it.
absolutely. Absolutely, thank you for that. Yeah, Trish and then Heath.
Thank you. So I just want to note that in that letter, there actually weren't any timelines on when we might expect that report to be completed, which, it makes it hard for us to plan and to have an idea of when we would be able to finally hear, a little bit about what went on in terms of response and what could be done next time. So it would seem to me that, I believe October something, I didn't catch the date, but is when the internal, review was ongoing. And at this point, they must have some preliminary findings that they can share, if not a complete report, which we know can take a very long time to go through all different types of people and processes that need to approve such a report. I do think that it's good to have some early discussions now on what can we do immediately to handle those situations better in the future. That's all I have to say about that.
Thank you, Trish, that's great. Heath?
I was just telling you, Chair, that she wanted to ask a question.
Oh, thank you. And may I remind the committee that the report was we only heard about the report after this committee had asked the Premier and EMO and Minister Thompson to come in. And then the response back was to create a report, if I do recall the timelines correctly. So this has started quite a long time ago. So further discussion on we're continuing on with further discussion on the motion.
Yeah. And could I just reiterate?
Emily, yeah.
I just wanted to make, kind of let the committee know regarding the Firefighters Association that they have agreed to come in. It was just in the fall, there wasn't, we kind of ran out of dates for meetings time, so I have been in contact with them. So it wasn't that they were ignoring the committee's request, it was just a matter of scheduling, and there wasn't any further available dates in the fall before the fall sitting had commenced. So I just wanted to make that clear to the committee on that particular item.
Thank you, Emily. Heath?
Just sitting here listening to this, I certainly agree with Corey. I don't think there's any need to bring anybody in until we have a report in front of us where we can reference the report and reference the action of EMO for the storm Dorian. And rushing them in here and worrying about a storm in a week or 2 weeks is not going to, our opinions prior to that report is not going to change anything. So I believe that let's do it right. Let's get the report. Let's review it as a committee, and let's ask the appropriate questions at the time.
Anybody else want to speak to the motion? Yes. So I guess we'll call for the vote. So do you want to read
Sure.
the motion out again? Then we'll...
It was moved that the committee chair send a letter to the Premier to reiterate the request to come and speak to the response to Hurricane Dorian as soon as possible.
Sorry.
Based on the conversation here, I'm willing to, rescind that motion to pull that back, but I do believe that perhaps a letter requesting some timelines on when we would see this report and, perhaps an update on what the status is of this report would be appropriate.
Vote to withdraw a motion that needs to be unanimous consent. So I would suggest that since they're on two different topics, if it's okay with the committee.
So we would have to withdraw, we need unanimous consent to withdraw that first motion as a committee. Do I have it? Yeah. Okay, perfect. So that would be withdrawn. And then do we want to follow up with a further motion just asking for timelines? Let's vote on this second motion asking for timelines from the various people.
So that motion would have to be moved.
that motion would have to be moved. So a secondary motion would have to be brought to the table and vote, the second thing you said.
Okay, so I move that we send a letter requesting timelines on the report as mentioned, and any other updates on the process of that report.
And the report.
Yeah, who is writing? I should have it. Yeah.
Clarify, since that letter was from the Minister of Justice, is that who the committee would like the letter to go
Yeah,
to?
the last letter that was read out was from the Minister of Justice. Would that be an appropriate place to send this correspondence? Asking for EMO would be under, yeah.
Justice.
Perfect. So we'll do that. We'll send that letter to,
Sorry, the motion has to be voted on.
yeah. So at this time, if everybody's okay, we can vote on this motion? Question?
No.
Oh, you asked a question. Yeah,
I can read it.
yeah, okay. Emily,
So it was
read
moved by Trish Eltas that the committee send a letter to request the timelines on the report as mentioned in that letter dated November 12th, and any other updates on the process. And that would go to Justice and Public Safety and the Emergency Measures Office.
Is it okay? Is the committee okay with the question? Okay. All in favor? 2, 3.
Aye.
Okay, it's unanimous. Okay, all the committee members vote in favor of the motion.
Okay, perfect, okay, got that?
Okay, thanks for that, everybody. So we'll move on to continuing on, so you're gonna go through.
Yeah, so I guess does the committee want to?
Okay, yeah, so at this time, we're going to look at, we're still updating the committee's work plan. So B, does anybody have anything at this time they would like to talk about? It's motion number 4, referring child vaccinations to the standing committee. Passed in the Legislative Assembly on November 26th. Attached agenda further discussed by the committee. So at this time, it's open to the committee to talk about that. Heath?
So is this part of our review of our prioritized list that we're doing now, Chair?
Yes.
So can we do, is it possible to do new business first, to add, I think you have additional items?
Yeah, so it's up to the committee. So we could move to see about everybody's, what they want to bring to this committee at this time. And then at that point, we'll see, we'll put them all down and we'll move forward with that. Is that okay? Okay, so we'll just take some time to get everybody's opinion about who they would like to see come into this committee and talk. Yeah.
Sorry, the committee doesn't want to deal with 4B
No.
through D at this time?
No. We do have, before that, we do have 3 requests though. Was that, do you want to?
Yep, keep adding to it, and then prioritize them. That
Okay.
would be my suggestion.
Okay, so I'll add those two. Smoke-free PEI made a request to come in and speak to this committee. Heart and Stroke PEI made a request to come in. They've been working on a couple things around motion number 1, and as well as Juvenile Diabetes Research Foundation. So they would like to come in and talk about things. Michelle?
So these were all requests by these organized to come speak?
Correct.
Okay, I don't have any issues with their requests.
What do you want to add to? Yeah. Okay, so we'll add those to the work plan, those 3. Yeah, perfect. So we'll keep going now to keep adding more from the committee members. This is the time where you can add whatever organization you see fit to come in and issues why. I'll go with Heath.
I have 3 items here. That social assistance announcement, December 23rd. I was wondering if we could get the minister and/or his designates in from the Department of Social Development and Housing to appear before the committee to address government's current plan to relative single living allowance. I want to know exactly what that means, and is it reducing red tape? Is it reducing the impediments of the tentacles of government? I'd like to know a little more about that. And it was announced with collaborator Hannah Bell. And I was wondering maybe Hannah could actually come before us as well. So that's one item.
Okay.
Do you want to deal with all 3 or one at a time or what?
Let's deal with that one first,
Okay.
I think. Anybody can speak to that.
Hannah's a member of this committee.
Yeah, she is a member of this committee, I do believe. So I'm not sure. I'm not sure how that would,
Proceed, yeah.
but
What's the process on that, Emily?
I guess the committee could invite her. So we have had in the past, members come before committee for different circumstances. It would be up to her to determine if she would want to come in, but in the past we have had committee members that have come in to meet with committee as well. So I guess if the committee wants to start with the minister, or I'm not sure how the committee wants to move forward with that one.
Michelle?
I can't speak for Hannibal, but I would think her passion towards this subject and, you know, her contribution to ensuring that Islanders have the opportunity to live with more dignity, I would think that you could ask her to do that.
Yep.
And I think that that would be actually a nice thing.
And
for
then
the
if she
committee to
agrees, we
do.
can figure out, her place would be replaced.
We deal
for
with that
voting.
as a caucus, yeah.
Yeah, for sure.
For sure. Brad?
Yes, so to the clerk's point there, you know, maybe not, you know, let's invite the department to come in, representatives from the department to come in and speak. And the minister will likely choose to accompany them, but really they're the ones that, you know the program details inside and out. And I would suggest we probably have the department present either on the same day before Hannah, or, you know, just to make sure you got all the correct facts on the day from within government. That's what I would suggest the department should present first.
Yeah.
Okay, then it's up to the committee. It's up to the committee as a whole to decide who specifically they invite. So,
Yeah, so, no,
Corey?
Was Heath, I don't know, were you asking for both to come at the same time? Is that what?
I'll repeat it again. Invite the minister and/or his designates.
Yeah, perfect.
perfect, right.
Okay. Everybody's okay with that?
And also
His designates?
Hannah, or sorry, I'm just determining what the committee would like.
I think
Who the
Hannah
committee
will
like to-
certainly add to the conversation, yeah.
Sure. Okay, perfect. We will get letters off and, about that request. Perfect. Any other discussion with that?
Or we'll move on to Heath number 2.
Still, we talked a little bit about, obviously, the doctor dilemma, and we know that it's gone up over, patient registry's gone up over 16,000 people. So I'm just wondering, we talked about allowing doctors to recruit doctors, we talked about community involvement, but, you know, I keep hearing from people in the Crapo area, and I think it might be worthwhile to actually have them come in and explain the impediments and the barriers that they faced, whether it be trying to recruit a doctor or whether it be any issues with health PEI or what have you. So it'd be interesting to have that group come in and just kind of give us an insight on, you know, learn a little bit about what the challenges that they're facing or have faced. So that was one.
Great.
Yeah.
Okay, perfect. So we can maybe have a little discussion on that too. What would the committee's wishes be around something like that? We're talking about the Crapo recruitment of doctors, or that general area, trying to sustain rural healthcare in their community. Trish?
Thank you, Chair. So I think it's a really interesting idea. I think, you know, there's certainly, I imagine, a lot we can learn through that experience. My only sort of concern is that when it's my understanding, when a committee sends a letter, that a group or individual is compelled, you know, to come and speak to the committee, and I have a little bit of a caution about choice. So I'm wondering if there's any way it can be worded, we invite you to come, but without them feeling like they have to if they're not comfortable in this setting, or if they would rather submit something in writing. I don't know. I guess that's my only sort of caution, but I would love to hear from them if they want to come and speak. You know, I don't know how we can frame that, but
I'm sure that they're welcome to, yeah.
yeah.
Maybe I think it's all in the wording, and if, you know, if they're not comfortable, that's so be it, but I have a feeling that some of them will be comfortable to come.
Yeah.
They've been pretty vocal.
And then we'll invite, just because of room, we could tell them that there's only allowed 3 people on the floor of the ledge, but it's open to the public as well.
Yeah.
So,
Submissions. Anything to add here? Yeah, Brad?
Do you know who exactly you'd address that letter to?
They have a body that's actually in charge of that. So I think when, if I recall, when Jamie did his, there was some of that group that were here, There is a committee set up. I'm not sure the exact title that they call themselves. It could be the South Shore Committee of,
Intervention.
so,
Outside the rail.
Yeah.
there you go, South Shore Health and Wellness Incorporated. So they do have a chairperson and, actually.
Perfect, okay.
That's who you would send the request to.
Yeah.
Okay.
Okay, perfect. Thank you. So we'll add that too as well. Yeah, perfect. And your final one, Pete, to great.
Final one is recently, or about a month ago or so, Mona O'Shea said the situation has reached a point of crisis relevant to nurses on PEI. It'd be great to get Mona in to appear before the committee to discuss the state of the nursing complement and what she sees as a direction or a positive direction for nurses recruitment and so on and so forth.
Great. Okay, perfect.
Anybody had anything to add there?
Yeah, Trish?
Thank you, Chair. So this actually, adds on well to what Heath has been talking about here around recruitment and retention. So I would, agree. I had Mona O'Shea on my list, but I do think this is a topic that we need to delve into much more broadly. There's a lot of questions about sort of who's doing what exactly and how that is playing out. So, I would suggest that specifically around recruitment and retention, we send a letter to the Department of Health and Wellness, an invitation to have anyone working on recruitment or whoever they think would be the most appropriate to come and talk to us about those strategies and exactly what's going on, and particularly around retention as well. I think it's always good we put those two together because I have a lot of questions about what we're doing specifically in terms of retention of our doctors, nurses, and other healthcare professionals. In this same, umbrella topic, I think the College of Physicians and the Medical Society. I would love to hear a little bit more about the data collection around retention specifically. So I know that we've been told there is a survey that has been conducted just before Christmas or is being conducted soon with doctors and any doctors who have left the province within the past 5 years. I'd like to know more about that survey, if it's been administered, what are the questions, how are we doing it, and if there are any results yet, I don't know, as well as the exit interviews that are being conducted with doctors who have left. Sorry, I'm giving you a whole list of
I'm just trying to make
things.
sure I don't want to forget anything.
Yeah.
So that would be number 3, the exit survey. So we've got the department, retention and recruitment, somebody from their area, the college, which would be separate. So
Medical Society,
Yeah,
also
Medical
separate.
Society.
And someone to talk about data collection and what's being done with it around retention and contributing to, what is the retention strategy and how are we tracking retention and understanding the issues that are keeping doctors here and the things that are driving them away. How are we gathering data around that? As well, I would suggest Tanya Nace is the executive director of World Hope International. She is an expert in recruitment, particularly doctor recruitment and health professionals in challenging areas to recruit across the world. We're very fortunate to have her living here in Prince Edward Island, and I think she would be a fantastic reference to call into this committee to hear her knowledge and experience around recruitment and retention of healthcare professionals.
just to clarify our last name,
N-A-C-E.
NACE.
Can I also seek just a clarity on the data collection? Is that something that's being done in the department or with one of the associations of?
It's part of the retention strategy, recruitment and retention strategy document, the 5-page document that the minister released. So to be honest, I'm not exactly sure who is doing that, but perhaps that is a letter that can go to the department specifically around data collection and what that entails, what are the questions they're asking, how are they asking them, and all of those pieces. I'd like to know more.
Perfect.
Quick question to the member. You said call in. Did you mean call in or actually have her come in? Ask her to
Call
come in.
her in. Yeah, sorry.
Join us. Call in.
I would like to invite her to join us. Is that, yeah. Okay, thank you. No, sorry, she's here in Prince Edward Island, so.
Do you see us being able to cover this in one day?
I don't know. I would say probably not in one day, and it is a lot. But that's the reality of this topic, is that it is quite complex, and if we're going to understand the full picture, I think we need to really look at all of these different areas.
Yeah. You know, just thinking plan.
Yeah.
So it's,
Yeah.
I want to make sure that it's a very big issue in Prince
sure.
Rupert, so it's great to bring up. And we will start with, you know, that process about getting that information out. Unless, does anybody have anything they want to talk about? That? No? Okay, perfect. We'll put
I did have one more
Go ahead,
thing.
Trish.
Separate from that, although connected, the electronic medical record system. So what are the plans for that? Do we have, there's supposed to be an RFP coming out. I would like to hear about how that has been developed. Are we, did we take into consideration the pilot that occurred previously, and what were the findings of that? And what are the next steps moving forward? I just want to know more about the EMR RFP that's going out and what the next steps will be.
And would you like to see that request go to the minister and him
It would seem to me that's probably the most appropriate.
Whoever's
Yeah.
leading the project,
Yes, exactly. Yeah, we
what's
wanted.
your project manager there?
project manager and the
Yeah.
minister?
Yes, exactly. Yeah,
Perfect.
Thank
Just trying to clarify for that. Anything else?
for sure.
Great, yeah.
All right. Trish, anything else?
No, that's it for now. Thank
Okay,
you.
perfect. Michelle or Corey, do you have anything? Yeah,
Go
go
ahead.
ahead. Yeah, Corey? do you-
Just something I actually kind of came to mind was, and obviously this is something maybe the committee wouldn't be able to get to for a while because there's quite a bit on the work plan, but was the Kings County Memorial Hospital emergency room. And, well, it seems to be, not much has changed. It still closes early, or it's closed some days, and it's rather frustrating. So I don't know who we could call, who would be the most appropriate person to call in to discuss what, how we can
No, we can add that.
address that. I don't know if it's the minister or if it's, it's probably not the minister, maybe someone just a little underneath them, but
The director, maybe. So we'll add that to the work plan if anybody else wants to talk about that. But we'll talk about the state of the structural state of the building and
no, sorry, I was kind of more so like
yeah.
the emergency room itself, not the
Emergency room.
structural.
Perfect.
Well, that's another whole issue on itself, but yeah,
Okay.
we could talk about that another day.
Okay, so staffing issues. Yes, Michelle?
Is the thought that you were going to call the department in, or are you actually looking for like the lead doctor or the lead nurse to be part of it to actually
kinda what I'm-
talk about what's going on?
I literally just kind of came to mind here as I was sitting, we were kind of going through this stuff, so I don't know who would be the best person in to ask to come in, but
Okay, Emily will look into that too and bring the information back, and we'll definitely add that to her.
And just input on that one.
Brad Trivers?
Like we were talking about earlier, probably put the request into the minister and/or designates, I think the way he put it, invite the department, let the department choose who come in. Probably a good start to it there, They have all the facts at their disposal.
Yeah, it might be Health PEI, so.
Well, the committee wants the letter to go to the department, we can start there.
Yeah, we can start there at the department or at Health PEI or
Okay, so Emily will look into it. Okay.
yeah, she'll look into it.
Yeah, I'll bring some information back.
For sure. Well, this is good. Anything else, Corey? Did you have something? Okay, and I would just bring up one. I think it's good. We were talking about wellness today. I would like to invite the Physical Education Teachers Association president and past president to come in and speak about the state of physical education and what they're seeing in the school system and what can be done and what measurements need to be put in place to get our kids healthier. So, and that would be Stanley Chasson and Megan Morrison. So, yeah. Michelle?
You already have public schools branch in?
No.
Okay.
No. And that's another option. We can go to public schools branch to ask them if they're going to come in or want to come in and talk about that. So, yeah, that could be a request.
So I mean, your initial suggestion, it's the Physical Education Teachers association.
Yeah.
I think is a good one, right? Because they'll have a very, specific perspective as physical education teachers. I mean, within the Department of Education, Lifelong Learning, we have people who, have responsibility for physical education curriculum, for example. That'd be other people that could talk to it, but I like your initial suggestion. I think that's a decent place to start, especially in lieu of today's presentation on wellness and how physical fitness relates to that and physical, exercise. So
Yeah.
I'd support that one. I think that's not a bad spot. We can go to the Department, Public Schools branch after that if we need to, but yeah.
No, I'm just wondering if that had happened already, because I'm not suggesting that we do that. I was just wondering if that was already something that had already been done as a, because I'm subbing in.
Sitting in.
Can I
Great.
comment?
Trish, yeah.
So I think if we decide to send out this invitation to the, what was it, sorry?
It's the Physical Education Teacher Association.
So I think to add to the value of that conversation, in that letter, we might indicate that we'd love to hear their views and what they have experienced around the social determinants of health and what they see in their students as barriers. So not just about what their recommendations are in terms of what kids should be doing to exercise more or how we could incorporate that more into schools, but to talk about their grounded experience in working with kids at that frontline level, because I think that there's value there as well. So
Brilliant.
just to add that to the letter.
Thank you, that's a great suggestion. Yeah. Perfect. So we've got some work to do. So, but this is the importance of this committee. It covers a lot, and I think it's we're going to try our best to give everybody a voice and hear as much as we can from now until the time the committee of the whole sits again. So, sorry, Emily, go ahead.
I guess just to confirm, so there was a lot of discussion under new business. So I guess just to confirm that the committee has agreed that everyone that we have mentioned and had talked about, they would like to invite in, and I'm happy to provide that list now if the committee would like that. And then if we've missed anybody, you can let me know. Okay. So regarding the social assistance announcement, to have the Minister of Social Development and Housing or his designates to appear before committee to discuss the single living allowance, and also to invite collaborator Hannah Bell to that meeting as well. And then the next one was on doctor recruitment, and to offer an invitation to the group in the Crapo area, which was the South Shore Health and Wellness Inc. And there was a mention that, it would be an invitation, perhaps also an offer for them if they want to submit something in writing, but that there is an invitation if they want to meet in person with the committee as well. And then also was the PEI Nursing Union with Mona O'Shea to talk about recruitment and retention with nursing. And then kind of to follow up on that, to invite, sorry, I'm just looking at my notes here, the Department of Health and Wellness, the College of Physicians, and the Medical Society, and Tanya Nace, who works with the World Hope International Organization.
Yeah, World Hope International.
Okay.
And she's a recruitment expert. So.
And then also I'll follow up, there was a question about the data collection around retention, so the survey and exit interviews and whatnot. So I'll check in to see who that might be related to and indicate that in the appropriate letter. And then on the electronic medical record system, to have the Minister of Health and Wellness in, plus the project manager, to discuss what the plan is for that. On the topic of the Kings County Memorial Hospital emergency room and the staffing issues, I guess I confirmed, does the committee want to send a letter off to the department to see who might be appropriate to have in, or to Health PEI? I guess they are two different entities, so is there a preference of where the committee wants to send that letter initially? And then, sorry, to conclude, regarding motion 1, Physical Education Teachers Association, and to have them talk about motion 1 and their recommendations, but also to talk about the barriers that they see with their students in regards to the social determinants of health. So sorry, to go back to the Kings County Memorial Hospital emergency room matter, is it the wish of the committee to send that to the department? Health PEI, is that works for the committee? Okay.
Yes, that works for the committee.
I mean, like, the department has overall responsibility. So I think you sent it to the department and you said, representatives from the department or contacts from Health PI as appropriate or something like that. I think it's important that the department's engaged, you know. I mean, Health PI is a separate, you know, body and organization, but I mean, the Department of Health and Wellness has to answer at the end of the day, right? You know, when the emergency room is closed. So I think it's really important. Maybe you send it to the department, let them engage Health PEI. I'm just throwing that up there.
Yeah, I just want to follow yeah, Trish?
I just wonder, you know, Corey, since you brought this one forward, are there any specific questions that you want to make sure our guests, whoever comes in to speak on this, will be able to answer? That might help, you know, if we're sending this to the department and they're making a decision, you might want to make sure that, you know, they know what it is exactly you want to hear about, just so they can send the right, you know, just my thought. If we're going to go that top level, I don't want that to be lost.
Yes. I would say, I'm certainly not looking for 2 or 3 people to come that are just going to give the same answers that we've gotten for, you know, such as, you know, usually when departments send ministers, no offense, minister, but, you know, sometimes we just get political spin. So I'm looking for, you know, perhaps it's, is it Denise Lewis Fleming or someone to come in and we can actually dive into the issue and not, yeah, that's, I'll stop talking there.
Sorry, Chair. That would be Health PEI that we're inviting, and we could specifically invite Denise Lewis Fleming. That would be, I'm comfortable with that.
Or maybe we send it to the minister and they can decide that who is best within the Health PEI or to come and present. You know, maybe
Oh, sorry, Corey.
maybe they would say, maybe, you know, the minister, Denise, would say, you know, these 2 people would be the best ones to come in and discuss that. I'm not sure, but.
Michelle?
I would suggest that a staffing, like it's a shortage of staffing, so whoever can speak best to a shortage of staffing within the department, that would make them make a decision on the changing the hours of operations if they can't actually man the positions that are required in order to keep the emergency room open. So I think the request should be specific to whoever can provide that information.
Okay, great. So did you get enough information there?
So the letter is going to,
Let's get both Department of Education and Health PEI. Is that it will?
Yeah, with
we'll send
specifics
it-
of what the requirement is.
Exactly.
so a letter to Department of Health and Wellness and Health PEI.
Yeah, and to address specific issues with the emergency room
Perfect.
closures, staffing,
Got it.
and functionality of the Kings County Hospital.
Does that sound okay?
Perfect. Okay, so thanks a lot for your patience. We're going to wrap it up here in a couple of minutes if we can. What's next? Trish?
Do we want to open the floor for a discussion on priorities? At least see if people are available to stay a little bit longer. I'm personally, you know, able to do so. I don't know how others feel.
Yeah, if you want to,
I
I'm
do.
available as chair. Uh-oh, somebody's children.
Okay, that's cool. Yeah, if people can't, that's fine too, but then I would like to go with Heath's suggestion of scheduling another time for us to talk about priorities.
Yeah. What time, sorry, go ahead, Corey.
I'm just wondering, when Emily sends out the letters, you know, maybe some of them will come back and say, well, we can come in right away, and they.
That's why I would like to have the discussion today if possible, but.
Yeah. Okay, Michelle, how much time do you have? Sorry.
I have 20 minutes.
20 minutes? Okay. Well, do you want to take it in, we can do as much as we can in the next 10 minutes or so. We can just keep going. Just want to make sure that everybody's time is valuable and want to just make sure we get as much done as we can here. Yeah, and we haven't addressed the 2 motions on the floor from the ledge too. Motion number 4, motion number 35 as well. Organ and tissue donations based on presumed consent would be 35, and as well as motion number 4, referral of childhood vaccinations to the standing committee. So, at this time, how would the committee like to proceed? Would we we have a lot on the agenda, and if we can what is the next 2 weeks like for our committee? Yes, Trish.
I'm just going to propose, and I'm going to throw this out there. So recruitment and retention, there was a whole list that we had all, sort of contributed to. How would we feel about prioritizing that list? Because we already have the next couple of weeks lined up. Sending out letters to the people on everybody under recruitment and retention as a first step, and then we can prioritize the rest of the list after that. I'm going to propose that because I think that that's an important topic that we need to find out about soon. So. As soon as possible.
Yeah, I'll open it up to the
How do other
committee.
people feel about that?
I'll open it up to the committee at this
This
time.
time, anybody want to?
So is that part of the South Shore group?
Yeah, I think so. I think that they are under that. So the list that I had given, and then Heath had the South Shore group and the Nurses Union. That's a pretty big list in and of itself.
Okay. So it's good to recognize people at this time, like who we're talking about here, because they don't hear it on Hansard. So let's if it's okay with the committee, we can move forward with that. I don't see that being a problem. Talking about recruitment and retention, and when the committee member speaks again, just list off your list of requestees. Yes, Trish, sorry.
Sorry, no, I'm sorry. Okay, so let's go with the list. So we had Heath brought forward the South Shore group as well as the Nurses Union, and please let me know if I'm missing anybody. And then the Department of Health, College of Physicians, Medical Society, someone to talk about the data collection around retention, and Tanya Nace from World Hope International. That is the list I have, if anybody has anyone else that I've missed.
Perfect. Thank you very much. Anybody else?
Yeah, there was one, I believe you missed the social assistance one.
That's not under recruitment and
Okay,
retention,
so
but
you're just dealing with recruitment and retention for the next.
that was my suggestion, but, sorry, did you want to
No,
introduce the people?
That's fine. So that was the list. That was her suggestion to just to have a blanket focus on recruitment and retention. And we could add, do we want to add, is Corey's suggestion to be part of that mix with Kings County Hospital? Trish?
I think it's certainly an important topic. I think it's partly recruitment retention, it is that as well, but it might be much more than that also. I don't know. I'm comfortable if you would like to add that to that list. I don't know how others feel, but.
I guess I'm trying to get Chair.
Yeah, sure,
I'm
Corey?
I'm trying to get more at like the operation of the ER, why it's closed. Well, obviously it's because of shortages, but I'm trying to get answers of what we're actually doing to fix the problem.
Okay, perfect.
Michelle?
I would suggest that we're probably going to get at Kings County Hospital and the ability to ask all of those entities of what the issues at Kings County Hospital is, because I think you have, especially I'm not going to guess, but I think you've got shortages. So retention and making sure staff are happy, I think that's a.
So what I'll do at this time is we'll leave that out of the initial block. So we'll go with the initial block that was suggested by Trish Alter. Is that what the committee would like to prioritize at this time?
That's my question. Sure.
Okay, yes it is. So we'll move forward with that at this time. Anything else? Trish?
Very quick, do we want to figure out when we're going to discuss the rest of the priorities then? Because we still need to prioritize the rest of the list. That was just, to get us through the next few weeks, but we do need to have that discussion. Where would you like to have it, or when would we all like to have that
And it's up to the committee. Heath?
Why don't we get through this section right here and get ourselves a base on moving forward, and then come back. Emily, you can forward us a list and what we're doing over the next 2 weeks, plus the ones that are not involved in recruitment and retention, and then we can sit down and actually kind of evaluate it.
Sure.
Because I'm feeling we're not going to give it enough thought here.
No, and what we'll do with that too is we'll put
will allow the people that we just talked about in that block immediate access to the committee, and we'll start
Cameras on.
booking a month or two out for the other people. They might come, they might not, so, yes, Trish?
Yeah, I just think not today, obviously, I completely agree, but maybe at the next meeting, we put that on the agenda to prioritize the rest of the invites, because even, there's still a large list, so
Yeah.
we need to have that discussion.
Interjection, yeah, Emily?
Sorry, from the clerk. To that, so at this point, there's no other meetings set at this point, but I'll certainly be looking at the list of who we have, and we'll try to set things up as soon as possible. And to Tricia's point, I'll make sure that we put the prioritization of the other items that the committee's discussed on the agenda for the next meeting. And that way it's still on the committee's radar. And then I will also work on the committee's first priority of this new business, which is the recruitment and retention, and those groups that were listed. And if that seems agreeable to the committee, that's how I'll move forward for the next little while.
Yeah, great.
Excellent.
So, so we'll move forward with that, so that's basically new business.
That's new business,
Okay.
yep.
Storm plan, you've done that?
Just to let everyone know that we do have a storm plan, and if there's ever a case of bad weather, that the chair will be consulting together if the meeting should go ahead, and if not, there's steps that we take. Everyone will be notified if a meeting has to be canceled due to weather.
Yeah. Perfect. Thanks for your patience today. This is an important meeting. We had to do this the right way, and I think this committee did. So thank you, everybody, for sticking around. Can I get a motion to adjourn? Trish? So moved.